Buenos días con todos.
Good morning,
Soy Carla
everyone.
Sáenz. Es
My
un gusto
name
estar
is
con
Carla
ustedes el día de
Sáenz, and
hoy.
it's a pleasure to be with you today.
Antes de dar inicio
And before we
a nuestro
get
seminario virtual,
started with our virtual
quiero
seminar,
darles las
I wanted
indicaciones
to
para la traducción.
tell you how to
Este
use the
seminario se
interpretation
realizará
service.
en dos idiomas.
We
Va a
have
haber
two
presentaciones
languages
en
for our
inglés.
seminar. There will be
Los que
presentations in
quieran
English and in
escuchar
Spanish. And those
enteramente
of you who want to
en
listen
español, por
in
favor,
Spanish
vayan
only,
al dibujo del
please
globo
go to
donde dice
the
interpretación en la
globe
parte de
at
abajo
the
de su
bottom of
pantalla
your screen where
y
it says
hagan clic
interpretation
en
and click
español si ese es el
on
idioma en el que
Spanish
quieren
if that
escuchar toda la
is
sesión.
the language in
Dear
which you want to hear
colleagues,
the whole
please,
session.
those of you that want to listen to this webinar entirely in English, please go to the bottom of your screen. You'll see a little globe that says interpretation, and click on it and choose English as the language in which you want to listen to this webinar. Buenos días entonces nuevamente. Como decía, soy
So
Carla
once
Sáenz,
again,
asesora
good
regional de
morning.
bioética de la
And
APS.
I am the
El programa
regional
regional de bioética
advisor
del que soy
on PAHO's
responsable
bioethics
hace
program.
parte
And
de
that
la Unidad
program
de
is
Ciencia y
part
Conocimiento
of
para
the
el
Science
Impacto
and
del
Knowledge
Departamento de Evidencia e
Division
Inteligencia
for
para la
the
Acción en
Department
Salud de
of
la OPS.
Intelligence and Evidence
Este
for
seminario
Healthcare
virtual
in
es
PAHO.
parte de
And
una
this
serie
virtual
de
seminar
seminarios
is part
virtuales
of a
sobre temas
series of virtual
relacionados con los
seminars
ensayos
dealing
clínicos que
with
son
clinical
organizados
trials,
tanto por el
trials
Departamento
that are
de Evidencia e
organized by the
Inteligencia para la
Evidence and
Acción en Salud de
Intelligence
la
Department
OPS,
for Action and
como
Health
con
on
la
the part of
Unidad
PAHO,
de
but
Calidad y
also we
Regulación
work
de
with quality
Medicamentos
and
y Tecnologías
regulation
Sanitarias de la
of
organización.
medicines and health technologies,
En la
also
sesión del
part
día de
of
hoy,
PAHO. In
el
today's
tema que nos
session,
convoca
the
es por
topic that we're
qué
going
y
to be
cómo
discussing
impulsar
is
la
why
colaboración al
and
investigar
why
en
should
salud.
we promote
Esta es la
collaboration
primera
in health.
sesión
And
que
this is
tenemos
the
en el
first session that we have
2025.
in
Espero que tengamos
2025,
muchas
and I hope that we
sesiones
will have
tan
many
productivas
more meetings
como las
and
que
that
hemos
those
tenido en
meetings
el
will be as
2024.
productive as the
Para
meetings
los
that we
que
held in
quieran,
2024. For
para los
those
que
of
quieran
you who
escuchar o mirar los
want
videos
to
de las
look
sesiones
at the
previas de
videos,
esta
the
serie de
recordings
seminarios,
of our
los
previous
invitamos a ir a
seminar
la página
series,
web del
please
Programa
go
Regional de
to the
Bioética donde
Regional
pueden
Bioethics
verlas
Program
y
website
además
and you
también
can
los
see
invitamos
past meetings there.
visitar el
Also,
portal de ensayos clínicos
please
de las
look
Américas de
at
la
the
OPS,
portal of
que fue
clinical
una
trials of
iniciativa que
PAHO. That's an
lanzamos
initiative that
luego
we
de nuestro
launched.
último seminario
It
virtual del
was launched
2024
after our
y también
last
es una
webinar
manera
in
de acceder
2024.
a
And that's
una serie
one
de
way
recursos
to
relacionados a
tap
los ensayos
into resources
clínicos,
that have to do with
incluyendo
clinical
los
trials,
videos
including
sobre esta serie.
videos having to do with this
Antes de
series of
continuar,
programs.
quiero
So
precisar
before I
que la
go ahead, I
OPS
want to say
no
that
va a
PAHO
emitir
is
un
not going
certificado
to
por
issue
participar
a
en este
certificate
seminario virtual,
for participating in
que
this
la
webinar.
sesión está
And
siendo
also, I
grabada
wanted to say that this
y
meeting
los
is being
invitamos
recorded, and we
a sumarse
invite you to join
a nuestra lista, a nuestra red
our
regional de
list.
ética de la investigación,
We
por
have a
medio de la
regional
cual les
network on
compartiremos el
research
enlace a la
bioethics,
grabación.
and we will share through that
Y
registration process
finalmente
the link
quiero
to the recording.
resaltar
So
que
lastly, I wanted to
que si tienen, vamos a tener
emphasize,
espacio de diálogo, de
and we will have
discusión, de
time for dialogue.
reflexión.
We
Creo
will
que
have time for
especialmente
discussion
esta
and to
sesión se
share
presta
thoughts.
a que
And
pensemos
this
juntos
session
qué debemos hacer para
allows
alimentar
us
las
to
colaboraciones en la
all
región
think together of ways to
y los
increase
invitamos a
collaboration across the
compartir sus
region. And we
preguntas en
encourage you
español,
to
inglés
share
o
your
portugués
questions in English,
usando
Spanish,
la
or
función
Portuguese.
de
And
preguntas y
for that,
respuestas que
please
nos
use
es
the
más fácil de
Q&A
manejar
function. For us, it's easier to
por medio
look
del
at
chat.
the
Todos
Q&A
los saludos,
than at the
material que
chat.
quieran compartir,
So all of the
con
materials
otros,
you want to
sí
share, all
les
of the
agradecemos
greetings that you may want
lo
to
envíen por el
send,
chat.
please do that through
Ahora
the
bien,
chat.
en la
Okay,
sesión de
then.
hoy
So in
vamos a
today's meeting,
partir con
what we're
una
going to do is
presentación
we're
que
going to
haré
start
yo
with a
sobre,
presentation. I'm going to be making a
sobre la
presentation
colaboración en
having to do
investigación
with
en salud.
collaboration in research, in health
Vamos
research.
quiero asegurar
So
que
here,
estamos viendo.
I wanted to make sure
Ahí está. ¿Me confirman, por favor, que se ve bien la
that you can
presentación?
see my presentation. Please confirm. Can you see my presentation well on the screen? Great,
Muchísimas gracias.
great, wonderful.
¿Por qué estamos haciendo una
Why
sesión
are
sobre
we
la
having this
colaboración
session
en la
on
investigación en salud?
collaboration
Algunos de ustedes
on
recordarán nuestros diálogos
health
que parece que fue hace una
research?
vida.
Some
Iniciamos
of
estos
you
diálogos
probably remember
regionales en
way
octubre del
back
2020
in
y
October of
estos diálogos
2022 when we
llevaron
started
a la
this dialogue.
publicación, al
You probably
desarrollo
remember
de esta
that
orientación, catalizar
exchange,
la
and
investigación
that
ética en
led us to
emergencias,
publish this
orientación
paper,
ética y lecciones
Catalyzing
aprendidas de la
Ethic
pandemia del
Research
COVID-19
During
y agenda
Emergencies.
pendiente.
And
Es
that
una
was
publicación
something
de la OPS del
that included
2022.
ethic
Está disponible en los
guidance,
4 idiomas de la
lessons
organización:
learned from the
inglés,
COVID-19
español, francés y
pandemic, and
portugués.
also the pending
Y
agenda.
pueden acceder a la
And it is
publicación,
available in
así
English,
como
Spanish, and
todas las
Portuguese.
publicaciones
And you
relacionadas
have
a
access to
este
this
esfuerzo
publication and
en
all
la
other
página web
publications related to
que
this
tenemos
effort.
específicamente
That
para este
is
trabajo.
on our website
Un
that we
problema que
have
resaltamos,
for
que surgió
this paper.
una y otra
Now,
vez
a
en los
problem that
diálogos
came up
previos
once
que
and again
llevaron a esta
when
publicación
we
y
engaged in the
que
dialogues that led up to this publication was,
mencionamos en la publicación
and something that
y
is
además
mentioned in
en
the
las
publication,
recomendaciones
and also this was
también lo
included
enfatizamos,
in the
es que tenemos el
recommendations where
problema de
we
que en
underscored it.
nuestra región hemos visto que se
The
hacen
problem that
muchas
was raised is that
investigaciones
in our region,
repetitivas y
there is a
pequeñas.
lot of
Entonces es en
repetitive and
respuesta
small
a
research
este
efforts.
problema que
So
una de las
to respond to that
recomendaciones
problem,
de esta
one of the
orientación es
recommendations
que
in the
tenemos
guidance
que
is
colaborar al
that we have
investigar.
to
La
collaborate
investigación en
in
salud
doing our research.
tiene que ser
Health research has
colaborativa.
to be collaborative.
Nosotros
And we
notamos que nosotros no fuimos los
see
únicos que hicieron esta
that we
observación de que
weren't
la
the only
durante la
ones
pandemia,
making that
de que la
observation.
investigación debe ser
That was
colaborativa,
during the
sino que
pandemic.
esto fue un
Everyone was
tema
saying
común,
that research
hasta el
needed to be
punto de que la
collaborative.
investigación
But
debe ser
this was
colaborativa se convirtió en una
said
suerte de
across the
mantra,
board.
¿no?
And
Hay que
so the fact
colaborar,
that
hay que
research had to be
colaborar. Si
collaborative
ustedes
became a mantra.
revisan los
You
llamados
have to
investigación
collaborate, you have
en
to
el contexto de la
collaborate.
viruela
And if you
símica,
look
casi
at
es difícil ver la palabra
monkeypox, it's
investigación
almost impossible
sin
to
que esté
see
seguida
the
del
word
adjetivo
research
colaborativo.
without it going hand in hand
Entonces,
with the adjective
nosotros
of collaborative.
proseguimos
So
en la
we,
OPS
in
con el
PAHO,
trabajo de
continued to work
impulsar la colaboración en investigación para la salud.
on promoting
Pero como les digo,
collaboration in health research. But the first thing that we
si bien todos
noticed was,
repetíamos que hay que
although
colaborar y hay que
everyone was
colaborar,
repeating, we need to
al hacer
collaborate, we need to
investigación,
collaborate
y
in
teníamos
doing our
escenarios de
research,
ausencia
and although we
de
had scenarios
grandemente problemáticos porque
showing
había una ausencia
that
total
there
de
were
colaboración,
major
no encontrábamos
gaps
en la
because there was
literatura
complete
un marco
absence of
ético para la
collaboration,
colaboración
but we
en
couldn't find in the
investigación.
literature a
Y
ethical framework
nuestro trabajo tenía
for
que partir de
collaborating
aclarar
in our
por qué
research. And we
importa que la
had to clarify,
colaboración
why is it
en
important?
que la
Why is it
investigación en
important
salud
that
sea colaborativa.
health research be
Entonces,
collaborative? And so,
digamos, porque era razonable que alguien diga, ¿y por qué tengo
because
que
of course,
colaborar?
someone
¿Por qué
could
tengo que
say
colaborar si
with a
quizás algo lo
shrug,
puedo hacer más
why do I
rápido?
have to
¿O por qué
collaborate?
tengo que
Why
colaborar
do
si
I
no
have to
quiero
collaborate?
colaborar? ¿Por qué
That
tengo
will
que
slow me
hacer
down.
el
I don't
esfuerzo
want to
de
collaborate.
colaborar
Why do I have to make an
si
effort to
quizás no
collaborate
provoca colaborar?
if I don't want to
Entonces,
collaborate? So
nosotros vimos la urgencia
we
de
saw
desarrollar un
that
marco
it
ético
was
común,
important to
valores
develop
guía
an ethical
para la
framework
colaboración que
with
justificaran la importancia de la
value to
colaboración en salud
provide
y que
guidance to
esperamos,
underscore the
y para esto
importance
estamos
of
en esta discusión el día de hoy,
collaboration
nos
research for
sirvan
health.
de
And
orientación
we
para
want this to
impulsar en la práctica la
be
colaboración en nuestra región. En
something that guides us to promote
esta publicación
collaboration in
que
research and
muestra acá,
health.
que
And this
está
publication, the
en J Global
publication
Health, está
here,
disponible
it's in J
para
Global
todos,
Health and
no,
is
no necesita
open access. You
pago
don't
para
need
acceder al libro.
to
No se necesita
pay
un pago
to
para
gain
acceder al
access. It's
estudio,
not behind a
al
paywall.
artículo. Se ancla en gran medida
And to a great
en
extent,
el
this is
argumento
anchored
de
in
que
the
la investigación
argument
en
that
salud
research
no es
in
una actividad
health
moralmente
is
neutra.
not
La
a morally
investigación en salud
neutral
es una
issue.
actividad que tiene una carga
Researching
moral
health
porque es
has a
necesaria
moral
para promover
overlay
el bien
because
común.
it's important to
Y
promote
esto es
the
algo en
common
lo que,
welfare.
para lo que nos
And
apoyamos en el trabajo de Alex
here
London, que fue
we
publicado
support our arguments by referring to this publication by Alex John London. It was published in 22-23, and I would say that it is perhaps the most important publication in terms of a theoretical framework for research ethics. And in this book, he talks about the ethical nature of research in health, because doing research, investigating, researching health is ethically justified, and the way that we do that research also is important from an ethical standpoint. So we do health research to promote health, and the way we do it cannot be morally neutral, because there is a way of doing faster research or to have greater impact or to gain greater benefits. And so that applies to emergency situations and non-emergency situations. So research in health is morally necessary. And because of that, doing research collaboratively has to be viewed as an ethical imperative. So researching health has to be collaborative. It should be. And by being collaborative, there are many different ways of doing research. There are many types of research. There is some basic research, there's applied research, but in general terms, being collaborative can involve four things. It's research that wants to engage other researchers that are in the places where the research is going to be carried out. Where is the study going to be done? We have to engage the researchers in the place where it's going to be done. Collaborative research should also involve researchers at the place where we think that the results of the research are going to be beneficial. In other words, where are we going to apply what we learn from our research? In X place, and there we have to involve those researchers. Also, research in health, if it's collaborative, is research that aims at working with other researchers doing similar research. We need to avoid duplication, which is the problem that led to this whole thought process. Plus, research has to be collaborative. It has to involve researchers that have the necessary expertise for the study that we want to do, whether or not they are in the place where the research is done, or whether or not they are at the place where we think the results are going to be implemented or that are going to be beneficial. So the more robust the research, there it's not only adding together 1, 2, 3, and 4. You have to involve researchers in those four different ways or categories as much as possible. The lesser the involvement, the less robust is your research. Now, what are the values? What values justify collaborative research in health? Well, first of all, efficiency. Why? Or what is the argument that's based on efficiency? The argument based on efficiency is that when you do collaborative research, you are speeding up the research. It's easier to do the research. It's more efficient to do research in place X if you have researchers in that place, and that may be essential to access the study's population or to deal with the local approval process for the research. And the second element has to do with benefit maximization. Now, why should research be collaborative? Because it helps facilitate the implementation of the results of the research. So we do research to support the common good, but it's the social value that is only obtained if the results, if what we learn from the research is actually applied. So You have to do collaborative research to increase trust and to facilitate the future implementation of the research's results. And a third value for collaborative research is the value of equity. Doing collaborative research collaboratively helps create research capacity and also to genuinely address health inequities. You necessarily have to have research capabilities, the ability to lead investigation research in the places where the studies are needed. In other words, for example, in the countries with low-income populations, they have to be empowered. They have to have the ability to research their own problems instead of just waiting for researchers in other jurisdictions and richer places will lead or carry out the research that they need. They need to address their health inequities. For that purpose, we need to have research capacity every place where there are health needs. These three different values, efficiency, benefit maximization, and equity, are three values that we have to balance in each specific case where we're doing research. And I insist, a more robust collaboration is collaboration that is better applied so as to assure efficiency, benefit maximization, and equity. But just like all other areas that we work on in ethics, what we're after is finding the best combination, the best balance amongst these values. There are some situations where you say, and let me give you an example. Sometimes you have to balance out respect and justice or fairness or benefits. So you try to strike the best balance of all these different values. And that's the same thing we have to do in the case of research. So what is the best balance amongst the three values for collaboration in a concrete research project? Because there are cases where it may be ethically justified to make some concessions. For example, say equity, which is a value that means building capacity, since that takes time to become effective, to be implemented. Perhaps in an emergency situation, it may be ethically justifiable to be less collaborative in research because we are pressed to get results from the research. So we may have to sacrifice the equity value slightly, a bit. And that is something that's ethically acceptable in this concrete case. So I want to make it clear that not all trade-offs are ethically acceptable. Respect, fairness, basic standards of scientific integrity are things that we can never deny, never fail to comply with. That is an ethical mandate, and those are basic rules that can never, ever be sacrificed. So I wanted to underscore that this way of seeing research and health is something that needs to be collaborative, and this is a new paradigm in terms of how we see research. Why? Because if research is collaborative, because that is ethical. It's not that I have a friend there or I really like this place or whatever. Now, that it is a duty and that we have the ethical duty to make health research collaborative, that doesn't mean that we have to be ruled by an algorithm because it's something that we automatically have to do, that we have to look at those 4 different ways of collaborating in each and every study. No, but it does mean that
la idea de que el punto de partida, el default, la posición de
the
base
default
debiera ser
point
la
of
colaboración
departure
más robusta,
has to be more robust
entendiendo que
collaboration,
puede estar justificado
understanding
apartarse
that
de una
it may be
colaboración más
justified
robusta
to step
que
back a bit
pone,
from a
que
more
pone en
robust
práctica
collaboration
tanto como es posible 1, 2, 3 y 4,
that
pero
puts
la carga de la
in
prueba,
place, to the extent
justificar
possible,
por
1, 2,
qué
and 3, 4,
uno se
but
hace,
the
hace
burden of proof
una investigación menos colaborativa
to justify why
está
your
en el
research is less
investigador. Es
collaborative,
decir,
that
no es que
is a burden on
uno
the
tiene
shoulders
que
of the
partir de
researcher.
que eso es lo que debe hacer,
So
y si
you
está
have to
justificado hacer
have as a
algo
point of
distinto,
departure that that is what
tiene que
should
hacer
be
el
done.
análisis a
And if you're
la
going to
luz de estos
do
valores y
something
explicarlo.
less,
Es
you
un
have
poco
to do an
como
analysis
quizás
regarding
una
those
analogía
values.
útil
And perhaps
es
a
la inclusión de
helpful
poblaciones en
analogy
investigación, ¿verdad?
is including
Antes hablábamos,
populations
bueno, que
for
como
research.
casi
Used
como
to,
un
we used
acto
to say it was almost
de caridad, ay, vamos a incluir a los
charity,
mayores, o vamos a
saying,
incluir a los
okay,
niños, o
we're
vamos a
going
incluir
to
a las
include
embarazadas.
children, we're
Y
going to
ahora,
include
y
the
en eso el
elderly.
mensaje de las pautas de
And
selección muy
now,
fuerte, debemos, ya no aceptamos estas
no
exclusiones
longer do
categóricas.
we
Entonces, partimos
accept
de la idea de
this
que
type
todos,
of strategy.
toda
We
la
begin with the
población
idea that the whole
relevante para
population
el estudio desde una
that is
perspectiva
important for
científica
the
debiera ser
study
involucrada, debiera
should
ser
be
incluida,
involved,
y
should
si hay
be
razones para
included.
excluir,
And if
damos
there
la
are
razón
reasons
y
to
excluimos.
exclude,
Del
then
mismo
we
modo,
have to
partimos de la
justify that
concepción de que
exclusion.
la
So we
investigación debe
begin
ser
with the
colaborativa
concept that
en el
research
sentido
should be
más robusto,
collaborative
y si
in the
hay
most
razones
robust
para
sense.
apartarse de
And if
ello, las
there are
justifica.
reasons to
Entonces, este es el
lower that
marco
commitment, we need to
de
justify
fondo
that.
para
So
esta
this is the
reflexión, y
basic
lo que queremos
framework
hacer el día de
that
hoy es
surrounds
pasar
our discussion
a
today.
dar un
And
paso
what we want to
siguiente, y
do
por eso
is to
tenemos a
take a next
investigadores
step.
de
And
distintos
that is why
lugares
we
de
have
la región
researchers from different places in the
para
region
compartir sus
to
perspectivas al
share
respecto.
their
Les comparto antes
perspectives.
de
So
dejar de
before
compartir y
I
presentar a nuestro primer
take my slides down,
investigador, nuestro primer panelista,
and
les
before
comparto
introducing my
la
first
manera de acceder
panelist,
a la
I
página
did
web
want
del
to tell you
Programa
how to
Regional de
go to the
Bioética de la
webpage
OPS
of
y
Papua's
además a
Bioethic
suscribirse a nuestra
webpage,
lista
and also
de
the way
ética de la
to put your
investigación, que es
name
una red
on
regional,
our
creo que es la red
list.
más grande que hay
It
en
is the
cualquier
largest
región del
network in
mundo
any region
sobre
of the
específicamente
world,
ética de la
and
investigación.
the network has to do with
Entonces,
ethics in
ahora
research.
yo
So now
quiero invitar a el doctor
I want
Carlos
to
Álvarez
invite Dr. Carlos Alvarez.
a unirse a nuestra sesión. Ahí está, gracias
I'm going to
Carlos.
call on Carlos. Here he is.
Carlos
Thank you,
es
Carlos.
médico
Carlos
especializado
is
en
a physician.
infectología,
He
con una
is
amplia
specialized in
trayectoria en
infectious diseases,
investigación, ha
and he
participado
has a
en
long
muchas
history of
investigaciones
doing research. He has taken part in
colaborativas. Muchos de
a
ustedes
lot
lo
of
recordarán
collaborative
por sus
research.
investigaciones en
Many
el
of you
contexto
probably
de
remember the
la
research
COVID,
that he did
la
within the context
COVID-19,
of
pero también ha sido
COVID-19,
investigador
but
principal de
also he
muchos
has
ensayos
been
clínicos
the
sobre
lead researcher
antimicrobianos y
on
antivacunas.
antimicrobial
Carlos,
and
adelante, es un gusto tenerte
anti-vaccine
con nosotros.
technology. So, Carlos,
Hola,
it's a
Carla.
pleasure to
Entonces,
have you here
gracias
with
por
us.
la
Thank you.
presentación y
First of all,
realmente por la
thank you for
invitación.
your
Y
presentation,
realmente es un
and
gusto
thank you
estar
for inviting me to take
conectado a
part in this
este primer
program.
seminario
It's
virtual
a pleasure to
y
be part of this
me alegra
first
muchísimo
webinar,
también
and
tener
I
tantas
am
personas
very
que están en
happy
este momento.
to
Veo más
see
de
that we
50
have
personas
so many
conectadas,
people
que
that
realmente
are
es
interested
bastante
in our topic. I
satisfactorio
see that we have more
poder
than
compartir con
250
colegas
people with us.
temas
So it's truly
apasionantes
a
como
pleasure
el que tú
to
nos
talk
invitas
to
hoy
colleagues about these
que podamos discutir y
exciting
reflexionar.
topics
Voy a
like the
compartir mi
one we
pantalla
are
para
discussing
poder
today.
seguir
So I'm going to be sharing
adelante
my
con
screen
la
so that
presentación. Por favor,
I
me
can
confirman
use
si
this
se
to support my remarks.
ya la están viendo en modo presentación.
Is this in presentation mode?
Ahora está perfecta, gracias.
It is now, thank
Perfecto.
you.
Bueno, entonces en los
Okay
siguientes
then,
9 minutos
so
que me quedan,
in
pues
the
voy
9
a
minutes that I
comentar
have
algunas de las
left,
cosas que
I
ya
am going
Carla
to
comentó extremadamente muy bien acerca
cover
de
some
la
of the
importancia
topics
de la
that Carla
colaboración.
just
Voy a
brought
contarles pues
up,
la experiencia
talking about
que tenemos y lo
research.
que
And I'm going to tell you about
refiere
our
a trabajo
experience in
especialmente en
terms
Colombia,
of
que realmente
collaboration,
hemos tenido
especially here in
también
Colombia,
donde hemos intentado
that
hacer trabajo colaborativo, una acción
is
colaborativa con algunos países de la
something
región.
that also
Podría
applies to
decir
our
que
collaborative work with
en
other countries in
principio
the region. So
partimos
I
de
should
unos
say that
obstáculos globales
We found
Como
some
ustedes ven en la diapositiva,
global
cuando hablamos
obstacles. You can
para
see them
obstáculos
here
en la colaboración,
when we talk
como a
about
veces
obstacles to
burocráticas,
collaboration.
institucionales, a veces no
Sometimes there are
solamente de los
bureaucratic,
gobiernos, sino también algunas
institutional,
veces de las mismas
regulatory
instituciones de
barriers.
salud, porque todos aplicamos
Sometimes we find that in some
diferentes,
health
porque
institutions because we
tenemos
have different approaches,
diferentes
or we
sistemas de
have
regulación,
different
porque
regulatory
sencillamente dentro de sus
systems,
instituciones no
or
está
our
establecido o
institutions
inmerso lo que es
aren't
el proceso de investigación clínica que permita
fully
facilitar
aware
trabajos colaborativos
of clinical
y luego
trials and how
segundo
they are
es el
conducted.
tema
Then
de
second,
financiación y tener recursos
we find a lack
disponibles, no
of
solamente que
funding,
tengamos
a
el
lack
recurso
of
financiero, sino que además
resource
tengamos
availability. So we need to
profesionales
have financial
capacitados,
resources, and also we need to
expertos en los
have
diferentes aspectos de
experts,
cómo va la
people
investigación
with
clínica y en
expertise
esto
in
hago
the
énfasis
different
porque
aspects of
muchas veces
clinical trials.
el trabajo
And often what
colaborativo
we
o
find
la
is that
investigación
collaborative work
clínica se piensa
or
siempre en
clinical
investigadores principales, que
research,
tengamos buenos
a lot
investigadores
depends on our
principales,
lead
investigadores,
researcher.
pero la investigación
But
clínica pues implica otras
clinical
cosas
research
adicionalmente,
means other
otros
things.
aspectos extremadamente
It
importantes y otros
involves
grupos
other very important
profesionales
aspects.
que
And
se necesitan de su experticia, como químicos farmacéuticos,
we
enfermeras,
need
como
to have
administrativos,
pharmaceutical
monitores de
chemists.
investigación,
We need to
para ver
have
si no
nurses,
resultan
people
factibles
that
tenerlos o
are
tenerlos
well
para el
acquainted with
paciente.
research.
Y en este
And if
tercer
we don't
punto
have those people, we need
planteo
to train
la
them.
fragmentación de los actores e
Also,
instituciones en los
it is
cuales
important to be able to
vemos
coordinate all of these
como lo planteaba
institutions.
Carla en la equidad,
As Carla was
también
saying,
ocurre equidad dentro de
under
algunos
equity,
países. Y entonces
also we
tenemos
have to look at equity across
instituciones
countries.
grandes,
So in
públicas,
some
más
large
privadas,
public
con una
institutions,
menos
private
cantidad de recursos
institutions too,
para hacer
sometimes there's a
investigación
lack of
clínica
resources to
y
do clinical
afortunadamente
research.
tenemos otros
And
sitios en los cuales
fortunately, we have other
no hay esa
places
capacidad ni
where
ese interés por muchas razones
there's a lack of
que hace
interest, a
que
lack of
se
capacity for
dificulta
different
poder
reasons. And that
involucrar a
means that
estas
it's
instituciones de
hard
salud
to involve those health
investigaciones
institutions
que
in
probablemente podrían hacer
research
muchísimo más
where
actores principales que
they
a veces las
could
instituciones ubicadas en
play a
ciudades
much
capitales. En ese
more
sentido, menciono
important
Colombia, por
role
ejemplo, que Bogotá
than they do.
está, digamos,
Bogota,
cierto
for
punto más
example,
cerca de las estrellas, pero tenemos
is
no tantas
closer to the
enfermedades transmitidas
stars
por
because
vectores,
of its
afortunadamente, y
elevation,
cuando se quieren hacer investigaciones con
8,500
las
feet.
transmitidas por
So
vectores,
when you want
pues a
to
veces
look at
es complejo
vector-borne
tener
diseases,
la
it's
posibilidad
hard
de hacer
to get the
investigación
possibility of doing
del nivel necesario
research
en
at
las
the necessary level
municipios donde
in
probablemente
those
hay una
municipalities
mayor
where
impacto de estas
there may
condiciones
be a
clínicas.
greater impact
No
of
es tan
these
fácil
diseases.
la articulación entre la
It's
academia,
not so easy
las
to
diferentes centros de
coordinate
investigación
among the
universitarias con las
academia,
organizaciones
university
entonces colaborar
officials, and
con
also
las organizaciones de
collaborating
salud, las instituciones
organizations such as PAHO,
financiadoras,
other
que puedan facilitar
financial
la misma
organizations
industria farmacéutica y el gobierno.
that
Creo
can
que
fund the
también puede ser intentos, pero
pharmaceutical
todavía vemos que depende
industry
mucho
and
de
the
las
government.
personas
So all
más
of
que de
this
una
goes
política
to see that we depend
gubernamental
a lot on
local que
people
haga que esto funcione de
rather
manera importante. Y eso no
than
solo dentro
government
de la
policy.
academia, por poner
This
el ejemplo
became very important not only during the pandemic,
sino también lo vemos en condiciones
but
no
we also see
en periodos
this
interpandémicos,
in
de esta manera.
non-pandemic
Y
situations.
claramente,
And
pues a veces no hay
clearly,
el incentivo de la colaboración pública ni
sometimes
las
there's a
públicas en la
lack
misma
of
región y a
incentives
veces
for
nos
collaboration within a same
hacia la
region.
búsqueda de alianzas con
So
países de los que
sometimes
están en las latitudes nortes que probablemente los que están al lado.
a few countries in the southern
Las
hemisphere
dificultades
favor
van de la mano con
partnerships
problemas
with
socioeconómicos
northern countries.
que
So
todavía
all of these
dificultan
factors
el
weaken
proceso de que la
collaboration,
gente tenga en cuenta en las diferentes instituciones de salud
and we need to take into account that
los
different
componentes
health
importantes y
institutions
básicos
research as one of the
pronto, por
important
ejemplo,
components of
el
health.
sistema de ciencia y
For
tecnología que
example,
está, como lo decía, en el
the
Ministerio de Ciencia, el Ministerio de
technological
Salud está dentro
system
de
in
sus
Colombia
atribuciones
is
y
within
por
the
eso se
Ministry of
necesita,
Science
como
and
otras veces también, pues
Technology.
una limitación que se tiene en el país.
So this is a limitation
La
in the
falta de acceso
country.
a infraestructura y
And the
tecnología
lack of access
fragmenta
to
la calidad de
infrastructure and
eficiencia de los recursos,
technology
porque
is
no
also a
solamente
barrier.
de técnicos, sino de profesionales tenemos a veces dificultades
Sometimes
en la formación de
we
investigadores
have
en temáticas
difficulty in the
lingüísticas y éticas, como
training
también
of
tenemos esta,
researchers
esta
in
iniciativa
ethics
que he liderado Carla de poder
and
tener esta
bioethics.
capacitación y hace que
So
muchas
there's
veces
a need
nuestros
to
comités
train
de ética en algunas instituciones no
researchers,
son tan
and
fuertes y robustos como uno quisiera, que pudiera
sometimes so
facilitar un
these
mejor
institutions
desarrollo
don't work
entre
as we
los
would
que
like them
ejercemos ideales en investigación.
when it comes
Ah,
to ethics.
claramente compartir
Clearly,
datos y resultados de investigaciones no es tan fácil.
it's not
La
very easy to
cultura nacional
share
hace que se
data
consideren
and
periodistas
research
que no son
results.
periodistas
These are
fáciles de
often
pagar por poder hacerlo,
published
o
in
se publica
journals
en inglés y
not
muchas veces
easily
los
accessible,
comités
or
editoriales
access to
no
those
los
journals
manejan de forma
is,
adecuada, o
you have
simplemente
to pay to
verifican
access
el
those
acceso como
journals. So
tal,
some of
no
those
están claros
journals
los
are
requisitos
only
que se
published in
requerecen
English,
a
and
la
that
medida que pasa el tiempo, pues
makes
se
it
van
difficult for Spanish
desgastando. Es
speakers or
importante
speakers of other
que
languages to understand the guides.
mencionaba hace un momento los desequilibrios
And
entre lo que ocurre en
also there's a
desarrollo
lack of
técnico de una
balance
región
between
o de un
our
municipio,
regions
una localidad,
or
y las necesidades
municipalities or
específicas
location technical capability and the research
toca
needs. As
esperar que
Carla said, sometimes
otras
we have
latitudes
to
busquen investigar los problemas de nosotros. También algunas veces ocurre
wait
al
for
interior
institutions to look
del
for
país, y
researchers,
se
and
puede
this
darnos
happens
el ejemplo de Colombia.
inside
Eh,
and outside of our
hay
country.
a veces los acuerdos de cooperación no son tan
Sometimes
claros y a veces también las
collaboration
expectativas
agreements
no son
are
tan
not
claras.
so
A veces
clear.
no es tan claro la expectativa de
The
alguna persona que va a colaborar
expectations
en
of
las
some
tareas o
collaborators are not
obligaciones o ese
very
papel
clear.
que debe desempeñar dentro de las obligaciones también como investigador, hace
So
que
sometimes the obligations of researchers are
actores y
not clearly spelled
expectativas
out.
y percepciones diferentes, desequilibrio entre los beneficios de las
There's a
colaboraciones
lack of
que no se esperan
balance
en una región y que
between the
espera un un
benefits
investigador,
of
porque
collaborations.
no hay a veces mecanismos efectivos de
Sometimes a
monitoreo y
collaborator
control
is
que
in an
garantiza
institution
el
and
financiamiento.
there's not a
Eh,
specific monitoring or
hay
follow-up
con respecto a la falta
mechanism. And
de
as
problemas en
to
los estándares de integridad científica, pues
the
creo que uno de los
problems
puntos
of
importantes es de que
scientific integrity
con todas las
standards,
limitaciones
one of the
técnicas
important
y
thing
las
is that
limitaciones y
there are
falta de
barriers
conocimientos de
for
estándares locales,
technical
dado
capacities,
que vimos
publications without open access
sistemáticamente
nor
bajo
equitable
el involucramiento de la comunidad
dissemination,
científica,
and
no
there's
solamente mía,
a
sino la
small
comunidad en la
involvement
cual
of
se va
not only of the
utilizando el
scientific
blanco de la
community, but
investigación.
also in the
Entonces,
community that is
el
the
hecho de
target
darse
of their
ese
research.
involucramiento desde la fase temprana
Because an
permite que la
involvement since early
implementación de
on
los posibles resultados a
makes
ese
sure that the
ecosistema
implementation of
sea
results to
efectiva
that
y de una manera
specific
propulsiva.
population will be more effective
Entonces,
and
dado
more
que
will
a
have
veces
more
se
impact.
produce una regulación en el nivel institucional, especialmente en los
So
sitios de mediana y baja complejidad,
there are sites of
ya que
medium and
en
low
la parte final
complexity.
de mi presentación,
And to
fundamental
conclude
siempre una red
my
de investigación
presentation, I say
robusta
that
y
it's
eficaz,
fundamental to
no acceso a
create
financiamiento público y privado,
research
seguir avanzando
networks
en la formación ética
with
e inteligente
clear
para los
integrity
investigadores y
rules.
todo el equipo de trabajo,
There's a need for
desarrollo
greater
instrumentos
access to
tecnológicos
public
que se
and
puedan
private
compartir,
financing.
el
There's a
fortalecimiento de
need
redes de
for
ética
training in
institucional
ethics
que
and
permite
scientific
la
integrity for
innovación
researchers.
local, el
The
acceso
development of
a la
shared
formación
technology infrastructure
general
is very important,
en idiomas nativos
and we need to
para que las
strengthen
personas manejen y
national scientific
promover
journals.
la
We
colaboración
also
para
need
manejar el balance, la eficiencia y
to
la equidad
promote
en financiamiento y
collaboration
cómo implementamos
to have a
mecanismos
better
de
balance of
participación
efficiency, equity, and
equilibrada en
benefit
en el acceso a la
maximization,
información,
implementing
generar
a
políticas públicas para la
mechanisms
convivencia y
for the
fortalecimiento
equitable
de los
dissemination
organismos
of
internacionales con
resources.
enfoque de
There's a
desarrollo.
need of
Hasta aquí
involvement
tengo
of communities and
palabras
beneficiaries in the
eh,
research, and we need to generate
Muchísimas
appropriate
gracias,
public policies.
Carlos, colegas. Vamos a
This
tener
is
un
my
espacio luego
presentation. Thank you very much,
para
Carlos.
debatir.
Colleagues, we will have later on
Creo que es
time to discuss
muy rica la contribución de Carlos en el sentido que hay
this
muchas
very
sugerencias
rich
bastante
contribution
específicas
of
que
Carlos with
podemos
several specific
conversar luego.
suggestions that we
Ahora
can
yo quiero
address
invitar
later.
a
And
unirse
now
al
I
doctor
want
Hans
to
Vázquez, que
invite
es también médico de
Dr. Hans
formación,
Vasquez,
con
who is a
formación en
doctor
epidemiología, y él
in
fue jefe del Instituto
epidemiology.
Nacional de
He
Salud
was
y
the
director de la
head
Oficina de
of the
Investigación del
National
Ministerio
Health
de Salud, que es
Institute in Peru,
supervisa los ensayos clínicos en el país
supervising clinical trials in Peru,
trabaja en una
and
organización que
he
implementa
works in an
ensayos clínicos,
organization that implements
de una
clinical
manera, digamos,
trials
en red, y creo que va a ser
in
muy valioso
networks.
tenerlo,
And this,
tener su
it will
presentación.
be very
Adelante.
important to listen to him and his
Gracias, Carla.
presentation.
Muchas
Yeah.
gracias a la OPS
Hans,
por
you
la,
have the
por la
floor.
invitación.
Thank
¿Me
you
escuchan
very
bien?
much, Carla. Thanks, Pajo, for the invitation. Can you hear me well?
Perfecto.
Yes, very well.
Entonces, yo no tengo presentación, pero voy a hacer
I don't
algunos
have a
comentarios
specific presentation as such, but I have a
acerca de
few
lo que
comments
comentó
about
Carla, acerca de la
what
presentación
Carla
siguiendo
has addressed and about the
línea
presentation
de
following
lo
the
sugerido por
line
los
of
expositores.
what was
¿Por
suggested
qué y
for
cómo impulsar la
presenters.
colaboración?
Why
¿Por
and
qué es
how to
importante?
promote collaboration? Why is this important?
Como ha comentado Carla,
As
yo
Carla
creo
has
que es
said,
una necesidad. Es una
this is
necesidad
really a
ética y
need, an
científica
ethical
y práctica,
and
porque sin colaboración no es
scientific
posible
and
hacer
practical
investigación,
need,
digamos, de
because
calidad,
without
¿no?
collaboration,
Para
there's not
impulsar
possible to
la
conduct
colaboración
quality research.
solos no podemos.
We cannot
Necesitamos
promote
conocer
just
muchas
by
cosas
ourselves
desde
collaboration. We need to know
desde
many
las brechas
things, from
reales de la
ranging
investigación
from
a
actual
través de
research
diferentes
gaps
perspectivas
through different
internacionales o
international
locales, no
or
solo de los
local
investigadores,
perspective,
sino
not
de
only
las
by
personas que
researchers, but
trabajan
also the gaps of people who work in
en determinados
specific,
problemas con una
addressing
perspectiva social
specific
muchas veces.
problems from a
Necesitamos hacer
social
sinergia
perspective. So we
con
need
otros investigadores,
synergies with
ya
other
sea
research,
locales, internacionales, locales, porque pueden
be they
tener
local or
un
international. Local,
entendimiento
because
mayor
they
del
can have
problema
a
local que
greater
queremos solucionar,
understanding of
internacionales
the
porque
local
pueden tener
problem we
conocimientos
want to
internacionales,
solve, and also
pericia, métodos,
international,
e
because
incluso
there's more
sinergia con investigadores que estén
expertise,
desarrollando
and
temas
maybe there are
comunes,
better
¿no?
methods, and
Pueden
also
usar,
synergies with
podemos
researchers
usar
working on
sincronicidad,
common
porque
themes.
también tienen más
So,
experiencia
because
en
we
desarrollar
might
algunos
well be
métodos para
duplicating
implementar
efforts,
mejor la
so we need
investigación clínica o
synergies
los ensayos
to better
clínicos que
implement
nosotros
clinical
necesitamos
trials,
para hacer
in clinical
nuestras
research with
investigaciones.
clinical
Han
trials
aprendido quizás
for results
soluciones
that we
para,
need.
ya
Maybe
sea
there
para la
have been
preparación de la
solutions
investigación, para la
to
implementación y todo el
prepare
proceso
research and
relacionados con
all
eso, ¿no?
the
Entonces, es
subsequent
importante
process,
la
including
colaboración
implementation. And it's
desde
important
diferentes
to
perspectivas, ¿no?
collaborate from
Desde la
different viewpoints
perspectiva
or approaches,
científica
from the
administrativa,
scientific
de la preparación del
administrative
estudio y de la implementación, de la
approach when
publicación, etcétera,
preparing
¿no?
and
¿Cómo
implementing a
hacerlo en
study
general?
and
No
publications.
todos
How to
ven
go
la
about this?
colaboración como una necesidad,
Overall, not everybody
ciertamente.
sees collaboration
Sabemos
as
que
a
es
need,
algo importante y es
but
una
it is
obligación y es
important,
inherente a la
and
investigación.
it's an
Algunos
obligation
podrían verlo
inherent to
como
research.
un
Some
problema, ¿no?
people might
Pueden tener
see
diferentes
this
perspectivas. Y no solo es
ethics as a
importante
problem. There
acercarse
can
al
be
tema de la
different
colaboración
perspectives, and it's not only
hacia los
important to
investigadores,
approach
porque hay
collaboration from
muchos
the
actores que participan en
standpoint
este
of
ecosistema
researchers,
para
because
promover
there are many
investigación.
actors that
Y estos actores
participate in
pueden
this
ser más
ecosystem to
relevantes
promote
incluso que
research.
los mismos
And these
investigadores para
actors
promover
can even
investigación
be
colaborativa en
more
nuestros países, ¿no?
relevant
Puede estar
than
los
researchers
funcionarios
themselves.
que participan
There can also
en la
be
regulación,
officials
puede
that
ser funcionarios que
participate in
participan
regulations or that
digamos,
participate
en brindar financiamiento público
in
o
providing
privado, ¿no?
public or
Puede haber
private
investigadores que
financing.
participan en el sistema
It can
público,
also
investigadores que
be the
participan
presence of
en
research that
investigaciones
participate in the
privadas
public
sin fines de
system
lucro, con fines de
or in
lucro, etcétera. Entonces, hay que abordarlo
not-for-profit
efectivamente
or
esta perspectiva,
for-profit
sobre todo en nuestros
private research.
países,
So we have to address this,
integral,
especially in
¿no?
our
Por
countries,
ejemplo,
from a
quien toma decisiones
comprehensive
en el
approach. For
sistema
example, those who
público
take
o
decisions
desde las
in the
autoridades
public
reguladoras
systems
podrían generar
or the
algunos
regulatory
incentivos
authorities could
para
generate a few
investigar de manera colaborativa,
incentives
porque eso le va a traer
to
mejores
promote
resultados,
collaborative
teniendo altos
research
estándares
on behalf
de
of better
seguridad para los
results with high
participantes y que los
safety
datos
and
obviamente
security
sean
standards
recogidos de
for
manera íntegra, ¿no?
participating, uh,
Generando mucha
supporting
transparencia, predictibilidad y
comprehensive data.
comunicación.
There has to be a
Puede
lot
haber
of
para
transparency,
incentivar el
predictability,
trabajo
and
colaborativo en nuestros
communication. This is very
países. Pueden
important
ser los
to
investigadores del
incentivize
sistema
collaborative
público, de
work
los
in our
hospitales,
region.
de los
There can be
institutos públicos,
researchers
que
in
podrían
public
quizás
system
estar más cerca
hospitals and public
de los que toman
institutes that
decisiones
might
políticas en el
be
sector
closer
público,
to
reguladores, con
political
algunos
decision
niveles de
makers and
transparencia,
regulators in
digamos,
the
sean de
public sector with the
diferentes,
adequate
con el fin de
transparency
que cada uno,
levels to
pueden ser
avoid any
legisladores
conflicts of interest, so
o
that
decisores políticos,
each
puedan
actor
entender
be they researchers or political decision makers, could understand the challenges, because oftentimes there's not adequate communication and different actors in different positions often do not understand clear collaboration, and this is a barrier for a positive system. Academics and researchers in public or in private institutions should be in contact or should be incentivized to contact different universities, local non-for-profit groups, so that all could be learning the process of research, grants, budgets, administrative topics, journals, publications. There are many aspects that oftentimes take years to implement and to learn about them, and oftentimes this is learned by doing mentorship, for example, involving sometimes a decision maker in the area of finance, implement work with senior and junior researchers, mentorships, etc., to involve researchers early in the process with adequate incentives and budgets. Overall, it's important to start. Where should we start? In our region, we have some institutions that could contribute a lot because they have certain background and proven experience in collaborative work, and there could be a partnership or a mutual approach to allow these institutions to contribute their experiences, and this would benefit institutions that are just starting their research. There could be national strategies to allow groups with experience to have incentives to collaborate with other groups in different stages of the process. Overall, our countries need a framework or an ecosystem that might be promoted by the public area with greater budget. This could incentivize universities, the public sector, and the private sector could have synergies and be induced to promote collaborative work. These are my comments. Thank you very much, and thanks for your presentation. Now, I want to invite Dr. Carlos Serrano Jr., cardiologist with a doctorate in medicine. He's a professor of the Sao Paulo School of Medicine, and he's the director of international relations of the Brazilian Medical Association. Go ahead, Carlos, the floor is yours. It's a pleasure to have you with us.
Listening here with me. I'm going to try to speak in English, and if I have some problems, I'll try to go through Portuñol. And it's a great pleasure being here and participating with everyone in this important seminar, which approaches a very important topic for everyone that wants to do research in health. I think it's very important for this exchange of experiences between other scientists, but I want to try to touch on some important parts that I consider very interesting in research, which is the international aspects of collaboration. So, as Carla mentioned, I'm International Relations Director of our Medical Association, and I am also a professor at the Faculty of Medicine in the University of São Paulo here in Brazil. And being that, I'm going to also mention part of our experience in doing these collaborations with international studies and with other countries. First, I want to mention the importance of international aspects of studies is that as we see here in Nobel Prize winners. It's very interesting that most of the scientists that were awarded are either from the United States or countries from Europe. So it's important for all the discoveries made on these projects should be shared all over the world, since most of these studies contributions have importance for other countries. Even between these countries, the United States and European countries, each discoveries help in very in aspects, and mostly in treating patients and diagnosis, and also with physiology of diseases and different aspects. So this is an example that I bring as for the Nobel Prize winners, that the international aspect and collaborations is very important. And I also want to mention here the importance of this article by Carla and her co-authors, and also to focus on the importance of the Pan American Health Organizations, which plays and can even increase its role in international clinical studies, mainly here in the Americas, as it can facilitate research collaborations and sets ethical standards and guidelines, and also shares data and transparency. So I want to take this at this point here, Carla, is to emphasize your organization for putting different centers in the Americas and doing collaboration studies here in the Americas. And as I see, what are the benefits of international research collaboration, mainly for universities in the academic field? I'm going to discuss 5 different points: enhancing academic quality and reputation, broadening research horizons and resources, preparation of students for a globalized world, addressing global challenges through united efforts, and mainly cultural exchange and building international networks. As for the first topic, for the first benefit, I just want to emphasize that it exposes universities to diverse knowledge pools and expertise. So I think that's very important, as well as it's an opportunity for universities to have high quality publications when they do collaborations with other centers, top centers. So this helps put up their own universities, and it's also facilitates when they go after fundings, when they have this kind of results and publications and studies that are very important. When these universities, even though very good alone, would not be able to have impact in their studies and publications. So that would be one point. Another point that I wanted to emphasize is the broadening research horizons and resources. So as the second line here, universities in environments lacking specific conditions can partner with institutions. So for example, here in Brazil, we have a very strong problem here with the climate changes, as everyone knows here with the Amazons. And we know that it's very important, these kind of investigations, to preserve the climate conditions here. But by itself, Brazil may not have all the resources to do this. With collaborations and with other countries and that are sensibilized with the importance of preserving Amazon, as an example, could also facilitate these grants and fundings. Another point is the preparation of students for a globalized world, not only in the health areas, but in the other professions. This kind of collaborations is very important, so they can actually do these networks and global practices, different cultures, and also they increase their chances of employing. Another point is addressing global challenges through united efforts. I think this, as I mentioned here, many global challenges, including climate changes and public health crisis, needs a collaboration internationally. We noticed this very much recently, as Carla also mentioned, with the COVID. So this kind of networks actually help control the disease as COVID did in many countries. And as I mentioned here, the networks is very important here for the mobility, not only for students, for the lecturers and the scientists is also ongoing and incoming. I think that's very important for increasing each institution's and knowledges, the exchange of information for each centers. I want to mention here some examples here in Brazil that I consider important, derived from collaborations. One is the authorship and citations of Brazilian medical journals, for example. When an article has a collaboration between authors in different countries, the impact for citation increases more, even if it's compared to national or when it's just international studies. So when we have Brazilian scientists writing articles with other and foreign authors, the chance of this article being mentioned and cited increases very much. So the collaboration of authorship increases citations in investigated authors, journals. Another point is when the articles are in English and Portuguese, the chances of getting cited it increases very much if it's the Brazilian only published in English or in other languages. So putting it in English and making it accessible for global, your article, putting it global access increases on more. And if it's in Portuguese only just for national access, so the both languages here increases the chances of being cited, your article. Also, the type of document increases citations, for example, short surveys, and also some categories are also more popular than others. And I mentioned here anesthesiology, dermatology, epidemiology, and health policies are much more cited articles than other specialties. And I also want to mention here, in our experience, as I mentioned, when we have an article together with foreign authors, the chances of being cited increases from 8% to 32%. So we have here an increase in international collaborations from 2009 to 2019, in 10 years. As you see here in the yellow line, there's a much increase of these collaborations when we mention medical and health. The other knowledges or other areas, the international collaborations are very stable or even decreased, as you see here in the blue line for engineering and technology, or in the green line, which is unstable in agriculture. So mainly here in Brazil, the medical and health articles have increased international collaborations in the last 10, 15 years. And as I mentioned, that has increased the chance of these articles being cited. As we mentioned here, the articles here in red is when we have there's an increase, very sharp increase of when the articles or the documents are published with a foreign partner abroad. So when it's only with a foreign partner and it's a Brazilian journal, as you see here in the blue line, it's a very shame here that these articles are very few and very few cited. So it's very important for us here that collaborations with foreign authors be published in other countries, not only here in Brazil. If it's only here in Brazil, we have very few people reading these articles, as well as few people mentioning these articles in their studies. So the international aspects of our studies have a very different view, even inside here in Brazil. Another aspect that I want to mention and share with you is the importance of having international clinical studies. Here's an example. In my field, when we actually study antithrombotic or glucose-lowering drugs, if we only do these studies in one country, we might mislead our conclusions. For example, Black African Americans as well as East Asians behave very different when comparing for antithrombotic agents. East Asians need lower concentrations of medications to have their therapeutic effect, sometimes actually half the dose as Caucasians need. So if we use the same dose in different populations, we not only might have less therapeutic effects, but we might increase side effects. So international multi-center studies are very important to identify these differences in populations. And finally, I want to share with you some point of discussion that's happening here, and it might affect, or surely is affecting, collaborations in research. Is that, as I mentioned, the U.S. is very important in these collaborations in studies, and with NIH actually momentarily having their fundings stalled, might affect these international collaborations. Surely here in Brazil, we have collaborations, and these collaborations are being affected. I'm not just mentioning this effect, that this, since it's a seminar going on, this could be an important point to be discussed, and we must actually face this for new realities for our collaborations. So Carla and friends, it's a great pleasure being here, and I'm very open here for discussion with you. Thank you.
Muchísimas gracias, Carlos. Quiero invitar a los panelistas.
Thank you, Carlos. I wanted to ask our panelists to come back to join us for this conversation. And I want to introduce my colleague, Sara Carracedo. She is a consultant for the regional program on bioethics. And Sarah is going to be moderating this dialogue.
que, bueno, no sé ustedes, yo tengo páginas y
So
páginas
I
de
have
notas que he
pages and
tomado
pages of notes that I
en-
have
de
taken
sus intervenciones.
from
Bueno, le
what
paso
has
la
been
palabra a Sara
said.
para que,
So with
para
that,
que
I
ordene
give the
nuestra
floor to
conversación.
Sara. I'm going to ask Sara to
Muchas
organize
gracias
this discussion.
a
Thank you.
todos por las presentaciones.
I thank all of you
Hay
for
varias
your
preguntas,
presentations. There's several
en
questions.
el chat,
Questions
pero
that we
creo
have
que,
received through
vale
the
la pena
Q&A,
empezar
but I
por,
think it is worth
una más amplia a
beginning
nivel regional,
with a
y
broader
esta va
question at
de-
the
para ti,
regional
Carla,
level.
y es
And I
¿qué
think that
propone
it's
la
a good
OEPS
question for
de
you, Carla.
estrategias a
What is
implementar,
PAHO
soluciones
suggesting as strategies for
a estos
implementation?
problemas de los
Solutions
cuales
to
han
these
hablado
problems,
los
the
tres
problems
panelistas,
that were discussed by our
desde una
panelists,
mirada más regional?
more from a
¿Qué se puede
regional
hacer? ¿Qué
perspective.
se está haciendo?
So what can be done or what is being done?
Estás en mute.
You are muted.
Gracias. Si ustedes recuerdan la estructura de las
You may remember that
recomendaciones
the
de nuestra
structure
publicación,
of the recommendations in our
catalizar la
publication,
investigación
where
médica
is
en
my publication?
emergencias,
But about
tenemos
catalyzing
dos tipos de recomendaciones. Hay
medical
casos en
research
los
in
que es
emergency.
claro
There
qué
are
es lo que debemos
two
hacer,
types
y hay
of case.
casos en
One
los que
where
debemos
it's
pensar
clear
qué
what we have to
debemos
do,
hacer.
and
Y
in other
este es un
cases
caso
where
en
it's
que
not clear what
no
we
hay
have to
una
do.
solución
And
obvia.
here in this case, there is
No hay una
no
solución
obvious
única.
solution. There's
Y hay
no
algunas
single
tareas
solution.
obvias,
And there
¿verdad?
are some
Y algunos de
obvious
ustedes
tasks,
las han
and some
mencionado.
of you
Por
have mentioned them.
ejemplo,
For example,
para saber
to
si yo quiero
know
colaborar, si
if
quiero
I
que mi
want to
investigación
collaborate,
sea
if I want
colaborativa,
to
imagínense que,
do collaborative research,
que yo
just imagine.
soy,
Let's
yo
say that
estoy
I
en,
am
soy peruana, digo, estoy en Perú y quiero hacer una
Peruvian.
investigación
I'm in Peru, and I
en
want to do
Cusco sobre un
research
problema que
in
afecta
Cusco.
a las
And
personas
this
en
is a
las
problem
alturas.
that is affecting people at
Y
high
quiero
altitudes.
sumar, quiero
So
colaborar con
I
quienes ya
want
están
to
haciendo
collaborate
esas
with people that are
investigaciones.
already doing this
Pero
research.
en
But
muchos lugares de la
in many
región no hay un
places in the
registro
region, there
público y
is no public
transparente
or
sobre
transparent
qué
registry
investigaciones se están realizando.
for me to find out
Entonces, no
what research is
podemos
underway.
saber,
So
uno
I
no
really
sabe
can't know.
cómo,
You
quién
really
está
don't know.
haciendo esa
You don't
investigación.
know who is
Entonces, si
doing
bien
that
hay tareas
research.
muy obvias,
So
por
there are
ejemplo,
tasks that are quite
asegurar
obvious. For example, to
el registro público de todas
assure a
las
public registry
investigaciones,
of
no
all the
solamente
research
eso en
being
adición a la
done.
publicación,
So
las
that in
investigaciones que se
addition to the
están realizando
publication,
ya.
but the research that's
Esto es
already
algo que la
underway.
OPS
That is
viene
something that PAHO
apoyando
has been supporting
en casi todos los países de la
in
región.
almost all
Se han
countries in the
cambiado ya las
region,
normativas para
where
requerir
we
una
have changed
transparencia
the
sobre
rules to
la investigación que se hace.
increase the
Pero
transparency
seríamos
on
muy
research that
ilusos
is being
si
done.
creyéramos que
But
eso basta.
it would
No,
be foolish
todos
to think
ustedes
that that's
han
enough.
marcado una serie de
All of you have
desafíos
talked
pendientes. Y
about
creo que el
pending
trabajo que ahora
challenges
tiene
and the work
que hacer la
that
OPS,
has to be
y
done
por
now
eso
by
estamos
PAHO,
iniciando
and that is
esta
why
reflexión
we are
juntos, es cómo
all
podemos
thinking about
apoyar
this
de una manera
together,
sistemática
is how can
en la
we
región
systematically
el que
support
tomar
in the region,
esas iniciativas que ustedes han mencionado.
how can we
Y
support
voy a dar
taking the
algunos
initiatives
ejemplos
that you
las notas.
described?
Carlos Álvarez
Now,
mencionaba
Carlos
que es que la
Alvarez
práctica de la
was saying
colaboración depende de las personas porque
practicing
faltan
collaboration
políticas
depends on people
institucionales.
because there are no
Y yo me
institutional
pregunto, ¿cómo
policies.
son estas
So
políticas
I
institucionales
wonder,
que necesitamos?
what type of
¿Qué
institutional policies do we
características
need?
tienen que tener? Y realmente
What
no
do those
es,
policies have to be
creo que
like?
todos estamos de acuerdo en lo
And I
general,
think that we
pero
all
cuando pensamos
agree,
en las
generally
acciones
speaking,
concretas,
but when
todavía
we
quedan
get
un
down to
poco
concrete
ambiguas, ¿no?
actions, they are less clear.
Hans hablaba, por ejemplo,
Hans, for
de la
example,
necesidad
was
de
talking about
incentivos,
the
de
need
crear
for
redes.
incentives, of
Crear redes
creating
es algo que
networks.
la OPS está
And creating
trabajando
networks is
ya
something
para
that
algunas
PAHO has
áreas.
been working
Carlos
on
Serrano
for some
mencionaba algunas áreas
areas.
en que la
Carlos
colaboración,
Serrano
obvio
was
que tiene que
mentioning
haber una
some areas
colaboración
where
para hacer
obviously
investigación,
there
por
has to
ejemplo,
be
cambio
collaboration to do
climático.
research. For
Pero
example,
otra área
climate change.
obvia es
But
genomics,
another
en que
obvious
necesitamos
area is
juntar muchos
genomics,
datos para
where we
un
need
mejor
to
análisis.
pool data
Estamos
to
promoviendo
do
redes
better
también,
analyses.
pero
Also,
tampoco es
we
obvio
are
que con
promoting
simplemente
networks,
tener
but
una
it's
red
not
luego
obvious that just by
sabemos que la red
establishing a network,
ayuda, es como
we
una
know
gota
that the
de
network helps.
ayuda,
quote,
pero no
quote,
necesariamente
it
garantiza.
helps,
¿Hay
but it
algo que
doesn't
garantice?
necessarily guarantee.
Fue muy
Is there anything that
interesante
would
verla,
be a true guarantee that this will be
escuchar
done? It
el-
was interesting
la
to
reflexión de Carlos
hear
Serrano
from
sobre
Carlos
el
Serrano when
impacto
he
en las
was talking
citas
about the
de las
impact
investigaciones
on
colaborativas. Y es interesante
citation
porque
of
muchas
collaborative research.
veces
And that is really
tenemos un
interesting because
argumento
often
ético para,
we have an
debemos
ethical
éticamente hacer
argument
X,
saying
pero el
that
argumento
ethically we
ético no
need to do
necesariamente
X, but
motiva
that
la acción
ethical argument
suficientemente
may
y
not
es importante
necessarily motivate
resaltar
the
estos
necessary
incentivos
action.
también.
So it's important for us to
¿Cuáles son los
underscore those
mejores
incentives.
incentivos
What are the
adicionalmente
best
a este que se
incentives in
deduce de las
addition
publicaciones?
to the
Creo que es algo que todavía
incentive of
debemos
citation and
analizar.
other
No
publications?
somos
That's
los
something we have
únicos
to
en la
further
OPS
analyze.
que han
We in
puesto
PAHO aren't the
el,
only
que
ones
han
who
notado la
have
importancia de este tema.
noticed the
Quiero, por
importance of
ejemplo,
this issue.
compartir con
For example, I
ustedes
wanted to share
que
with
el
you
Foro Global de
that the
Bioética y
Global Forum on
Investigación
Research
del
Bioethics
2025,
from
la reunión que se va a hacer a
2025,
finales
the
de este
meeting that
año,
is going to be
va a
held
ser
late this year,
enfocada en
will
colaboración en
focus
investigación.
on research
Eh,
collaboration.
y
And
lamento no tener claridad sobre
it's
qué
really
acciones
sad that
concretas
we don't have
fuera de
clarity on
promover redes
concrete
y promover la
actions. So we
transparencia.
have to promote transparency, networks.
Creo que no tenemos.
Because
Si
I
alguien tiene
don't
una,
think,
por favor, los invito a que nos compartan. Si alguien tiene una solución muy
and if anyone has a solution,
más clara,
please
pero creo que es
share
una
it with us.
constelación.
But
Hans
I
hablaba de
think it's a whole
algo que
constellation.
atraviesa el ecosistema.
Hans was saying it's
Esa
something
es mi
that
opinión. No sé si
permeates the
quizás los
whole
otros panelistas
ecosystem.
quieren
So those are my reactions. I don't know if
agregar
other
algo.
panelists have anything to
Carlos.
add. Carlos?
Sí, yo creo que entre esas soluciones pragmáticas que tú planteas, hay varias que se han venido haciendo, pero vale la pena seguir estructurándolas,
Well,
¿no? Yo creo que uno de los temas
your
que
solutions
abordas
are
es una
several, but I think we
necesidad de
have to
tener
continue to
recurso
work
humano
on them.
calificado
And
para los
we
aspectos de
need
la
to have
investigación clínica.
qualified
Y
human
eso es algo que
resources.
sí se puede hacer
And that is something
de
that
una
can
forma
be
mucho más robusta, es
done
decir, no solamente
in a more
la capacitación
robust
de los
way.
aspectos
So
bioéticos,
not
como lo estamos
only
viendo, sino también otros
training on
aspectos, la parte
bioethic aspects,
regulatoria de la
but
investigación,
looking
los
at
aspectos que van
teaching
apareciendo en las
regulatory
inteligencias artificiales,
aspects,
qué es la monitoría clínica. Algunas veces tener
clinical
monitores clínicos
monitoring, sometimes
o
having
monitores o
clinical
monitores clínicos
monitors.
no es tan fácil. La
Sometimes that's
diferencia
not
en
all that
algunos aspectos
easy.
fundamentales que sí se pueden
Looking
hacer
at
de forma
aspects on
remota,
some
que
fundamental
claramente hay
aspects,
instituciones que
it can be
tienen mucha
done. There are
experiencia
institutions that have a
y
lot of
pueden,
experience and
contribuir
that
con
can
información
contribute
que
with
facilite a otros
information
países de la región o a otros sitios.
to
Entonces, yo creo que ese
facilitate
es un tema
including
concreto
other sites,
que
other
pudiéramos
countries in the
o
region.
se pudiera facilitar. También creo que en la parte
Also,
regulatoria
I
los
think
países
that
no todos
in
van a la
the
misma
regulatory
velocidad.
aspects,
Algunos
not all
tienen
countries move
dificultades
ahead at the
para
same speed.
incluso
Some
recibir
have
donaciones.
problems
Nosotros
in
ya lo
terms of
habíamos superado
receiving
ese proceso
grants.
hace un tiempo. Entonces yo creo que
We dealt with
ese
that
tipo de como
aspect
de
some
manuales
while
de
ago.
procesos sí
So
se puede
this
establecer.
whole matter of processes, I think, could be standardized.
Ya. Bueno, hay muchos
Well,
aspectos y no es
there
fácil
are a lot
abordar
of
el tema de la
aspects. It's
investigación
not
colaborativa, pero
easy
algunos,
to approach
muchos de
the aspect
los
of
que
collaborative
financian la
research, but a lot
investigación,
of the people
digamos,
funding
le
research
dicen, pues, oye, ¿tú
say,
quieres investigar?
you
Bueno,
want to
tienes
research?
que
Fine.
tener registrado tu,
So you
¿no?
have
Te voy a dar
to,
dinero si
I'm
tienes
going to give you
registrado tu
money
estudio,
if you register your
si te
study.
contactas con esta red, si trabajas con
Or
esta red,
if
no
you
puedes
work
trabajar
with this
solo,
network, you
¿no?
cannot work by
Y
yourself.
tienes que tener, pues, investigadores
So
junior, tienes
you
que
have to have
demostrarme
junior
eso, con eso te voy a dar
researchers,
más
you have
puntos. Entonces,
to
un
prove
elemento
that you're going to do
importante,
that will
no
increase
absoluto,
your
no va a
score.
solucionar todo, sí
So
que
of course that's not
los financiadores públicos, instituciones de investigación
a
puedan
magic bullet, but the
incorporar,
idea
como lo
is that
hacen
those that finance
instituciones
research, and this
internacionales,
is something done
estos
by
elementos
international institutions, they
como
could
condicionales
include
para hacer
these elements
investigación.
as
Entonces,
conditions
quien forma
to
grupos,
do research.
de todas maneras,
So
y muchas veces es una competencia, si no
often
la
there's
mayoría o todas las
competition
veces,
too.
se ve la necesidad de
Almost
hacerlo
always, if not
y en el
always,
aprendizaje y de
that
trabajar juntos
is
se van
necessary.
formando,
And
quizás puede ser un primer impulso, pueden ser impulsos,
that could be a first
digamos,
boost,
durante la
or
implementación, se dan dinero para muchos
otherwise
años,
during
etcétera,
implementation.
pero
Sometimes
también
they grant
podríamos
money for
explorar esa
many
ruta,
years,
me
but we
parece,
could
¿no?
also explore that possibility.
Gracias.
Thank you.
Creo que, a ver,
I
hay
think,
varias preguntas
and
y
there are
muchas
several
tienen en
questions, and a
común,
lot of
lo de las
questions
redes de investigación,
ask
la
about research
confianza entre la
networks,
comunidad científica,
also
barreras
trust
burocráticas. Creo que tal
in
vez
the
podamos empezar por
scientific
algo sobre las
community,
redes, que es algo
bureaucratic
que
barriers.
mencionó
Perhaps we could begin by talking about
Carlos
networks.
Serrano
That
en
is
su
something that Carlos
exposición.
Serrano mentioned in
¿Por qué es
his
importante estas
presentation,
redes? ¿Qué papel
because
juegan
why
estas
are
redes
networks
al
important?
momento de
What
construir
role
las
do
agendas de
networks
investigación?
play when
¿Cómo
research
hacemos para que estas
agendas are
redes
put together?
sean
How can we
promovidas
make certain that
y
the
tengan un
networks will
mayor
be
impacto
promoted and that they will have
nuestros
greater
contextos, en
impact
nuestros países, en la
in
región?
our context, in the countries of the region?
I'm going to try to answer in English, but if it's not clear, I'll try to in Portuguese also. I think all these the networks, it's very important, as if not only in the health areas, but if you, in all other professions, all these networks are very important. As do it in engineering, agriculture, and mainly here in the medical areas, it's very important. I think it's even with technology here, and we meeting other persons very quick and very fast, we can change information. But one problem that we need to be careful is how true are these networks that we're getting involved. So it's very important to have selected your members of this network that you at least you know them for sure, so that you can actually develop and trust what is being discussed. So we have to be very careful with these networks once they're being done. So it's not only doing the network thing, it's probably to start or ongoing, but it's very important to do the personal contacts with these research. So it's very different when we're discussing personal with investigations and meetings, and then not based only on online discussions or with networks. So I think it's for countries that need other countries that have more resources in technology. We need to be involved with these networks, at least to try to be actualized and updated with other. Here in Brazil, it's a very big country. So as I discussed this internationally, we can actually translate these problems or these situations nationally. So we have discussing here in Sao Paulo, but up north, the east or northern country or to the south, we have the very different centers and specialized people in other areas. So networks inside here are very important here also. And that's why we invested very much in technology and online discussions here.
Gracias, Carlos. ¿Alguien más quisiera agregar algo sobre las
Thank you,
redes?
Carlos.
Yo quiero agregar algo que es un
Anything
poco
more about
simple,
networks? Well, I have a
pero
simple
que
thing,
he experimentado yo estaba
but I experienced this
NIH antes
when
de
I
ir a
was
la
at
OPS, y he
NIH before
experimentado
joining
que,
PAHO, and there I
que
saw
muchas
that
veces
oftentimes,
esto es algo tan simple pero realmente
this
importante,
is very simple
los
but very important.
apellidos nuestros no
Sometimes
son
our last
entendidos
names
por los
are not well
investigadores en otras
understood
partes del
by
mundo, porque
researchers from
tenemos
other parts
dos
of the world
apellidos
because we
o
have
tres
two last
apellidos,
names or even three.
y a veces uno ve,
And
uno
sometimes
busca, digamos, va a la website y ve
you
un
go to
apellido
a
y luego
website, you
hace
see
una
a last
búsqueda
name,
en
and then
PubMed
you do
con el
searches
apellido
in
equivocado,
PubNet with
parece
the
como,
wrong
uno
last
dice,
name, and
"Oh,
then
este investigador no
one
tiene,
says,
uno
wow,
dice que es el
this
investigador, pero
researcher
no ha publicado nada,
appears
no
as the
entiendo, y ahí
researcher,
está
but
otra
he or
persona."
she has not
Entonces,
published
esto es
anything.
algo
I don't
muy,
understand. There's another
francamente,
person.
muy trivial, pero
This
veo
may
con
sound
tanta
trivial, but
frecuencia
I see this is a very frequent occurrence. There's a disconnect
digamos, el norte que usa un
between
apellido único y que es muy
the
fácil de
north,
identificar. En
which
investigador la
uses a
comunicación,
single last
nosotros
name.
usamos varios
And
apellidos
so
y a veces
that's
no se
very
sabe
easy
como cuál es
to
el que se usa para publicar.
locate a researcher, as opposed to our situation with 3 last names, which make it very difficult to do these name searches. But now we should spare no efforts to facilitate the traceability of who is this person responsible for this program has made that such and such publication. Oftentimes, we don't use SearchNet tools that are available to us and that could solve or reduce this
Gracias.
problem.
Hans
Thank you.
Carlos Álvarez, ¿querrán agregar algo sobre las redes?
Carlos Álvarez,
La importancia de promover las
you
redes.
want to add something? The importance of promoting networks.
La posibilidad, pues ahora que tenemos como
So
escala que se ha evolucionado,
now with that
poder
we
tener
have
la facilidad de tener como directorios entre
the
entre la
facility
región, ¿no? Que facilite
of have a
la
regional
facilidad de que, digamos,
directory
hay
that
artículos
would
conocidos, artículos
facilitate
publicaciones, pero hay unos que no son tan conocidos que de pronto sí vale la pena saber que alguien está trabajando en
the
enfermedad de Chagas, por
location.
ejemplo,
It would
enfermedad
facilitate
de
to
Colombia,
make it
son
easier
países
to identify
sencillo, pero no
who
es tan
are the
sencillo. No es
researchers.
tan
This
sencillo
is not
buscarlo porque
seems
hay
simple
diferentes
looking for names in a directory, but it's not so simple.
red,
So
pues podría
working
ayudarnos.
in network
Creo que
could
un tema importante
facilitate
que tú lo has nombrado
the
bastante
location
es
of
la confianza.
last
Eso
names
es una
and
cosa
researchers,
indiscutible.
and trust is
Es
very
supremamente
important.
importante
It seems
que
simple,
logres
but it is
tener
very
la
important
confianza en que compartir los datos,
to
compartir el
maintain
trabajo,
trust in
pues
that
va a
sharing
tener
data
una,
and
un
sharing
mejor
works
íntegro y eso
will be
me parece que
addressed
aporta
in a comprehensive and
en los trabajos colaborativos y en la formación de equipos.
ethical way. This is very important in the
Gracias,
collaborative
Carlos.
work and network
Perdón,
establishment.
Sí,
sigue
no,
tú, luego, Carlos.
el tema
Yeah,
de
Hans,
redes es fundamental, ¿no?
network, the area of networks is
Siguiendo la
fundamental.
línea de lo que comentaba
Along
anteriormente,
the lines of what I said
definitivamente
before,
muchos de los financiadores, por
definitely
ejemplo,
many
piden que de
funders
alguna manera estés
ask
trabajando con algún
researchers
grupo
that
de
you
investigación,
be
¿no? Y
working
cuanto más
with
sea
a
el
research
monto,
group, and
debiera ser la red más
the
consolidada, ¿no?
greater the
Obviamente las
funding,
redes permiten
the more
muchas
consolidated
conocer
should
las
be a
necesidades
network,
actuales de la
because this
investigación,
makes
porque
it
en la red
possible
trabajan
to learn
expertos de
about
diferentes
current
perspectivas
research needs, because
abordando un
different
tema o varios
researchers
temas,
in a
¿no?
network
Pretender
address
conocer a las
one or
personas,
more
digamos,
themes
en el
from
barrio, empieza a
different
conocer
approaches. So
quién sabe esto, quién sabe de
this
otra
makes
cosa,
it
quién
possible to
sabe
know different
de
people
diferentes
who is
aspectos
doing
sobre un
such
tema,
and
diferentes
such
temas
work on different aspects and different
relacionados
topics
a determinadas líneas de
related to
investigación, por ejemplo, y el
determining
financiamiento
research
está
lines,
relacionado
and
con redes,
funding
¿no?
is
Entonces,
related to networking.
es muy importante eso, ¿no?
Well,
Poder
this is
acceder
very
a
important. It's very
redes,
important to be able to
poder
access
organizar
networks,
redes,
to be able to work in networks.
todo eso relacionado, ¿no? Gracias.
All of this is very important.
Carlos Serrano.
Yes, I just wanted to
Carlos
add
Serrano.
2 other points is also for these networks are very important for educational matters, and it's not only for discussing science and projects and so on. So here, being long distance, and we can also use these networks actually for teaching matters also, but that's a very new, different topic. And one of the important things I think about the networks is that the rapidness, the velocity of sharing information is very fast. So if we're discussing with in a network, we're sharing information very quick with each other, and we're doing it with the personal or waiting for publication or for letters. So it's very important for us, this there's progress. It's very much faster, the progress in discussing with projects and science.
Gracias. Carlos Álvarez, ¿quieres agregar algo más antes de pasar a otro tema?
Thank you,
dos
Carlos
comentarios
Alvarez.
hizo
Something more before we
comentar
move to
Hans,
other topics.
de la importancia de cuando se habla
Hans
del trabajo
mentioned the
colaborativo en red,
importance about
también pensar
collaborative
que
work
poder
in
ser
networks.
la estrategia de colaborativo,
Another important
no
thing
lo
would
hacemos
be a
solos. Habrá
collaborative
gente que en
strategy,
la región es el experto en genómica, pero hay otro que es el
taking into
experto
account that not
en
everybody is
química,
an expert in
matemáticas, hay otro
everything. So
experto
we'd have
en tener
experts in
trabajo de campo,
mathematical
trabajo en la
models,
comunidad.
others are
Entonces, ese
experts
tipo
in field work,
de redes
community work, and
también
that
son
type of
complementarias, es
multidisciplinary
fundamental
read is
tenerlo presente.
complementary, and it's
Y algo
very important to have
se
this
debe
into account.
tener en cuenta
And
también
something I
es la
forgot
capacitación de no
to
solamente
mention when
investigadores,
I
también
mentioned the training not only of
la necesidad
researchers,
de tener abogados que sepan de investigación, que
we
sepan de
need
la
to
realidad
have also
empírica,
lawyers that are aware
científica,
of
que sepan
empirical
de
and
investigación
research
clínica.
matters.
Parece sencillo, pero
This
no es tan
seems to
sencillo.
be simple, but it's not so simple when
Es
it comes to
exactamente
joining this with
relacionado a lo que
clinical
yo quería
research.
comentar,
It's
porque hablamos de una
exactly
red
related
como
to
si
what I
fuera
wanted to
un
mention
club en
because
que todos somos
we talk
miembros,
about a
digamos,
network
iguales. Y
as
si
if
bien
it
todos son
were
igual de
like
valiosos y de
a club
respetables,
where all
estamos
members are
hablando
equal,
de,
or they are equally valuable and
es como
respectable,
una
of course, but
torre de redes, es
it's a
como una
tower
red
of
de redes,
networks. It's a
porque,
network of
porque
networks.
están,
That's the way we
para
should be
hacer una
viewing this
investigación,
because
Carlos daba
to
muchos
conduct
ejemplos de ensayos
research,
clínicos,
Carlos
se necesita
made
un
many,
expertise muy
presented
complejo.
many examples of
Necesitas
clinical
abogados,
trials
necesitas gente
requiring different
digamos,
expertise, lawyers,
personas más junior que procesos de consentimiento que tomen muestras.
junior
Necesitas
people, sample
el trabajo
takers,
logístico, hay que
consent workers,
necesita la coordinación con la
logistics
autoridad
work, coordination
regulatoria del
with regulatory
patrocinador.
authorities, with
Entonces es como un
sponsors.
bosque, es
So
un,
this is
bueno, bien decía
like
Hans, es un
a forest.
ecosistema y
Hans said
necesitamos
it was
redes para
it's an
todos
ecosystem
estos
and we
puntos. No se
need
trata de,
networks for
ay,
all
la red de
these
todos los
topics.
investigadores
It's not a matter
principales, de los
that
grandes
it's
expertos y ya se
a
acaba,
network of
¿verdad?
the all principal
Pero
researchers
nosotros
only and great
en
experts,
APS
and
hemos
that's
estado
it.
tratando de fomentar
At
distintas
PAHO, we
redes
have tried
y,
to
por
promote
ejemplo, hay
different
algunas
networks.
ahí les compartí el portal de ensayos
I
clínicos
shared
porque
the
hemos
portal of clinical
iniciado una
trials
red.
because we have
La
initiated a
UPS tiene
network.
hace como 30 años una red
PAHO
de las autoridades regulatorias
has
nacionales.
had for almost 30 years
Pero
a network
bajo ese
of
paraguas
national
podemos crear una
regulatory
subred
authorities, but
de
under
los que
that
autorizan
umbrella,
ensayos
there's a
clínicos
sub-network
para que
of
haya un
those who
espacio de
authorize clinical
colaboración y de
trials
ayuda
to
entre
have
ellos.
a
Luego hay
collaboration and
entes,
help
hay
space
entes que
among them, and also
acreditan
at
a
the
las
national
líderes de
level.
ética de
There are
investigación.
entities that
Entonces hemos creado
accredit
FORENCEL, el Foro Regional de los Entes
national
Nacionales
research
que
committees. And so
acreditan
we
a los
have
comités de
created
ética
a
de
national
investigación.
forum that
Pero
accredits
debiéramos alentar
ethics and
distintas redes.
research committees, but we
Estamos
should
trabajando
encourage
en
different networks. We are
estandarizar
working
modelos
in
de póliza de
standardizing
seguro, de contratos. Hemos
insurance
hecho una
policies
pequeña red
models,
de
contract
expertos
models,
en
and we
estos
have
aspectos
implemented a small
legales de los ensayos
network
clínicos.
of experts in the legal aspects
Yo
of
creo que
clinical trials.
debiéramos
But I
buscar
think we
como
should also,
de hacer una
at PAHO,
especie
we
de
should
meta red de
try
investigación
to
con las
implement
subredes y los
meta or
contactos
super
disponibles para el público
research network
y
with
albergarla en el
sub-networks
portal de
available
ensayos
to the
clínicos.
public and
Estamos viendo de hacer ese portal,
upload this in
hacer
the
una especie de
clinical
dashboard
trials
también
portal. We are
con información sobre los países.
considering implementing a
Quizás ahí
dashboard
también
with
pudiéramos
information about
alojar
countries,
la
and maybe there we
información
could also
sobre las redes.
integrate,
Honestamente,
mainstream
estos
the information
son
about
ideas que
networks. These are
se me ocurren
just ideas
recién. Yo
that
creo
come
que
to mind.
también algo que algunos de ustedes estuvieron
Some of
la
you
presentación que tuvimos sobre
were at the
la
presentation we
CTRP, que es el
had with
registro, la plataforma de
ICTRP,
registros
the
internacionales de ensayos clínicos.
International
el prototipo que la OPS ha
registry
desarrollado
of
para usar
clinical, international clinical trials,
inteligencia artificial
and we
y hacer
should
preguntas
use
a los ensayos
artificial intelligence by asking this ICTRP with natural language and receive natural language responses. That would also help to obtain more useful information with the registries that we already have, and also thinking about the issue of practical incentives for researchers to collaborate, as Carlos Serrano mentioned. This would also be an additional practical incentive to register our networks at ICTRP. These are simple ideas that come to mind. Thank you.
Vamos a, ya que han ido tocando varias de las cosas que
We
estaban
have touched
mencionando,
on different
quería pasar al tema de
themes,
los
and so I would
Hay
like
varias,
to move to
preguntas
the
sobre, los
ethics
comités de ética y
committees.
el
There are
funcionamiento que deberían
several
tener
questions
en este
about
tema. Y uno
ethics
concreto
committees and
es
their
cómo es que los
involvement.
comités pueden
Specifically,
abordar
how
el tema de
can
las
such
investigaciones
committees
colaborativas, cómo las pueden
address the
promover,
topic of
o
collaborative
si es que
research?
deben
How
tener algún
can they
rol,
promote this, or
algún
should they
criterio
have a criteria
a
or a
tener en cuenta
role
durante sus revisiones, sobre
to
todo estas
be taken into
investigaciones
account when
basadas
reviewing
en
these
evidencia?
collaborative researches? This is very important. Carla, you
Yo
raised your
creo
hand.
que,
I
a ver,
believe,
indudablemente los comités de ética y
well,
investigación tienen un
certain,
rol
absolutely.
central para que la investigación se haga de manera ética.
Research ethics committees have a
La OPS
central
siempre
role
insiste
for
en
these
eso, en
researches, but
mirar
at
la
PAHO,
ética de
we
la
always
investigación
stress
de una manera
approaching
sistémica. Las
research technique
instituciones
as a
tienen un rol, las
systemic
autoridades nacionales
issue.
tienen un rol, los investigadores
Institutions,
tienen un rol, los
national
comités de ética
authorities,
tienen un rol,
ethics roles,
quienes publican las revistas
national
científicas tienen un
researchers,
rol,
all of them
la
have a
academia
role,
tiene
and
un
also
rol.
scientific
Yo creo
publications, the
que
academia
como
also
otras áreas
have a role.
centrales a la ética y la
Just as
investigación,
other
como por ejemplo
areas
la
of
conducta
central
responsable de la
to
investigación,
ethics
la
and
integridad
research,
científica,
for example, is
este
scientific
aspecto
integrity, this
trasciende el
aspect
ámbito de
goes
acción, el
beyond
mandato y la
the
capacidad
area
de
of
un
action,
comité
the
de ética y
mandate, and
investigación.
the capacity of
Y de
a
ya
research
pasando a
ethics
hacer,
committee,
siguiendo las pautas
which already has many
ahora,
guidelines.
sabemos que los
We all
comités de
know
ética de la
that
investigación
research ethics committees
tienen un rol central,
have
no
a
solamente
central
por lo
role,
que
not
revisan,
only
sino por
because
su
of
rol
what
de
they review, but
abogacía
their
en el
role in the
Sistema Nacional de
advocacy
Ética
in
de la
the
Investigación.
national research ethics system.
Un comité de ética de la investigación no está en posición de asegurar que la investigación
A
se
research
publique,
ethics committee is not in a
siempre va a
position to make
reiterar
sure
la
that that
importancia
research
de
will be
de
published,
que la
but
investigación se
it can
publique para
reiterate
lograr
the
el valor
importance of
social de
publishing
las
that
investigaciones.
research so as
Y
to
creo que puede
accomplish
ser
the
un
social
gran
purpose
catalizador
of
de
the
una
study. And I think
reflexión
that that can
y
also promote
de un nuevo
thought,
paradigma
reflecting
para
on
ver
a new
las
paradigm
colaboraciones en
to
investigación de
see
una manera ética. Y yo creo que ahí
how
me gustó mucho
or
una
to approach
sugerencia
collaboration and
que
research in
hizo
an ethical
Eder
way.
Herrera,
And
decir, ¿por qué no
Ed
hacer una
Herrera
especie
said, okay, why not
continuar el trabajo con los
continue
principios y
the
las
work
preguntas
with the
y hacer unas
principles
preguntas guías más detalladas
and have guiding
para,
questions that are more
que uno
detailed
como
so
quien
that
lidera un equipo de investigación
say that you're in
deba
charge of a
responder
research
preguntas guías
team and
para
we
cómo
should have
uno
these questions
orienta,
that would
encamina su
provide guidance.
investigación,
So how
que luego
should you
puedan, por ejemplo,
carry out the research? How
guiar a
should
que no
you
solamente la práctica, sino la
design it so
justificación que
that
uno
not only
pudiera
in
hacer al
practice,
solicitar
but
recursos,
also
etcétera, etcétera.
to
Entonces creo que es
provide
un tema
reasons for
en
funding
el que
the
el
research
comité
project,
tiene una
requesting
importancia,
resources.
pero que
So I think that the committee does have importance in this area,
de todas maneras
but
creo que trasciende el rol
I think that
del
it does
comité
go beyond the
de
committee's
ética de
role.
la investigación.
Gracias. No sé si nosotros,
Thank you.
si los otros panelistas
I don't
tienen
know if the other panelists have
algún comentario
comments to make
Un
on
comentario en
the
la
role
línea
of the
de Carlos,
committees?
¿no? Muchas
Yes,
veces,
picking up on what
los
Carla was
comités de
saying,
ética que de por sí ya
often
tienen
the
pocos recursos en
RECs,
nuestras
first of all,
nuestra
usually
región,
they're poorly
y la verdad que
funded
lo que
in our
más
region.
les
And the
aqueja
truth is
en el
that
Perú y seguro que en otros
in
lados
Peru, and I'm
son
sure the same applies
los
elsewhere,
pocos recursos
they
destinados al
suffer
trabajo mismo de
from
los
a
comités de
lack
ética,
of resources
y
allocated
encima
to
a veces
the
cualquier
research
cosa
ethics
sobre
committees.
en nuestros establecimientos públicos,
And our
incluso
public
privados, dicen hay temas de
establishments,
ética
even the private
clínica
sector,
que el comité de
say
ética
there
en
are
investigación lo
things
resuelva,
that
o
have to
ética en
be
salud pública que el
solved by
comité
the
en
ethics and
investigación lo
public health,
resuelva.
or let the Research Ethics
Digamos,
Committee settle
o sea,
the
ya
issue.
de por sí me parece que hay
So
varios
I
aspectos
think
que
that
tiene que
there are
abordar
already
un
several
comité de
aspects that
ética,
have to be
varios
dealt with
retos que
by
tiene que
a
en el
Research
día a
Ethics
día
Committee. They
solucionar,
face several
eh,
challenges that they have
como
to
para
address.
ver otros aspectos que
And
podrían verse en el conjunto de un sistema de ética en
deal with other
investigación. De
aspects
hecho,
that could be
un
seen as
comité
a
de ética
whole.
cuando vea que hay
For
una
example,
investigación
an
que no
ethics
tiene
committee, when they see
colaboración
that
y
there
tiene
is a
un
research
diseño
project
dudoso, va a
that
decir
has
esto
no
de dónde está
collaboration,
saliendo.
or if the
Entonces,
design is
podría ser
poor,
un
they'll
elemento
say, where did
más
this
a
come from?
considerar
So
dentro de los
it could
muchos
be just
elementos que
one
va
more
a
element
tener que
for
ver dentro de la
consideration
validez
amongst the whole
científica,
long
el valor
list
social,
of issues having to do with
balance beneficio-riesgo,
scientific, social value,
participación,
balancing
colaboración,
risks,
etcétera, ¿no? Básicamente.
engagement with the population, et cetera, et cetera.
Carlos Serrano.
Carlos?
Yes, that's a very important topic when we do clinical studies, is the ethic issues. A very big study could actually fall down if it's not ethical, or and hardly, sometimes not even started. And it's also an important issue that worries any kind of clinical studies, mainly when we're doing drug testing. So, on being part of that, I just want to mention that at the World Medical Association, and Carla also participated in one of the topics meetings of this, updating the Declaration of Helsinki, which is the main document for the World Medical Association, which is focused on medical research ethics. So I think this document here actually helps the ethical committees in when they're looking at studies, since some important topics are being discussed here, just as protection of the human subjects, informed consent, risk-benefit assessment, and vulnerable populations, and also post-trial access. Some one of the issues discussed in this document. But it's a very important here when we discuss clinical trials is the ethical aspects of the study. And I think the Pan American Health Organization has a role here in supervising these aspects, as well as creating the network, as we mentioned here before.
Gracias, Carlos.
Thank you, Carlos.
Hay varias preguntas y ahora
There are
también están en
several
el chat, así que les pido
questions.
que
I've been reading the
no
chat
se olviden de
too,
utilizar la función
but
de preguntas
please
y
do remember
respuestas,
to
pero veo
use the
que
Q&A for your questions.
también
But I
muchos
see
interrogantes
that
sobre
there are
el
a lot
rol
of
de
questions
las
having to do with the
instituciones
role
educativas.
of
¿Cuál es el rol de
educational
las instituciones
institutions.
educativas
What is the
para
role
que,
of
por ejemplo,
educational
los investigadores
institutions
vean
so
a
that
la
researchers
colaboración como un
can
imperativo
view
ético?
collaboration as
Incluso,
an ethical imperative?
¿qué recomendación
What
darían ustedes
recommendation would you make?
y qué tendrían que tener en cuenta
And what
las
would you have
instituciones
to take into
educativas
account,
frente, por ejemplo,
or
a
what would
nuevos
you want
investigadores, a
educational
investigadores
institutions to
que
take
recién se están iniciando
into account
¿no?
regarding new
en la
researchers or people that are
investigación
just getting
y
started
tienen que
in
enfrentarse con
research?
estos grandes
And
desafíos
they
para
have
trabajar
to deal with
colaborativamente?
these major challenges to work collaboratively.
Yo creo que el
Carlos.
el principal
I think
rol
that the
es justamente
main thing
el de
is
liderar ese trabajo colaborativo, porque al final la manera como
leading the
se puede
collaborative
transmitir y se puede enseñar
work.
desde las universidades
because
los
what
grupos de
can
investigación
be
es con el ejemplo.
taught by
Entonces, creo
universities
que
is taught
si
by
una
example.
institución educativa dentro de
If
sus
an
grupos de
educational
investigación
institution,
fortalece
if
el
its
trabajo colaborativo
research
y lo hace, lo pone en
strengthens
práctica, al
collaborative
final
work
se
or
convierte en la
applies it in
mejor manera de
practice,
educar y
that
transmitir
is
a
the
las nuevas
best
generaciones la
way to
importancia del trabajo
teach
colaborativo.
the importance of collaborative work.
Quizás
Thank
esa
you.
sea una de las
And
brechas
perhaps that is one of the
claves
gaps
e importantes también en nuestra región, ¿no? Porque
that
en
are
general en el
important in our
mundo
region, because generally speaking,
la investigación, las
worldwide,
redes están estrechamente vinculadas con instituciones de
research
enseñanza,
networks are
universidades, ¿no?
closely
Entonces,
tied
academia, ¿no?
to teaching
Las cuales
institutions,
cumplen
to
un rol
academia.
de
And
formación de
those
los
institutions
investigadores,
do
son
train
parte esencial de las
researchers.
redes, digamos, por lo
That
que hemos
is an
estado
essential
hablando,
part of the
cumplen
networks that we've
función
been talking
esencial
about.
en las
So that's an
mentorías,
essential
en el
function, along
aprendizaje de
with
diferentes
mentoring,
métodos,
learning
del
different
proceso
methods,
de formación de
different
los nuevos
parts of
investigadores,
the training
y
process
participan en las
to
mismas
produce new
políticas públicas
researchers.
para que los
And they
decisores puedan
participate in public policy so
generar
that
también
decision makers
un
can
sistema,
also
digamos, que promueva la
produce
investigación, ¿no?
a
Entonces,
system
en
that
nuestros
supports research.
países,
So in our countries,
muchas veces las
often
universidades pudieran tener un rol más
universities could
de enseñar
play
aspectos teóricos y participar
a
un poco
role
en este
teaching
rol más
theoretical
activo
aspects
de
and take
participar
part in this more
en
active
redes, en
role
la
of
investigación, en la parte
belonging
más
to
práctica,
networks
operativa de las
for
investigaciones clínicas,
research, the more
ensayos clínicos.
operational side of clinical research.
Sí, de acuerdo, yo pensaba
Yes, I
también en
agree.
algunos,
I too was thinking about
en algunos aspectos relacionados
some
a los
aspects having to do
desafíos de los
with
investigadores
the
más jóvenes,
challenges faced by junior
que
researchers.
a veces,
Often,
digamos, parte de la mentoría,
or
parte del
let's say,
entrenamiento de
part of the
estos
mentoring, part
investigadores
of
más
training
jóvenes
these
no es solo
junior
en
researchers is
metodología,
not
no
only
es solamente en
methodology,
teoría,
it's
es
not
en
only
temas
theory,
prácticos,
it
pero
is in
también creo que
practical
nos
aspects. But I
beneficiaríamos
think that we
todos
would all
si
profit
reforzamos
if we
como parte del
reinforced,
entrenamiento,
as part of the training,
temas de
if we reinforced
integridad
topics
científica,
having to do with
porque
scientific
ningún
integrity, because
investigador
no
joven
researcher
debe creer que
should
es
believe
aceptable que
that it's
sacrifique
acceptable
su
to
rol de
sacrifice,
autoría,
quote, quote,
sacrifique, no se reconozca el trabajo
it's
que él o ella hizo como un
or
costo
the work
de
that
colaborar con
the
otros.
person
Entonces,
did as a
creo que
cost
debemos
of collaborating with
insistir
others. So I
en
think that
que
we do need to
alentamos la
insist,
colaboración,
we
ahí
need to say,
debemos
okay, we're
balancear a veces,
encouraging
quizás
collaboration,
a veces lo
but
más razonable es apurar la eficiencia,
perhaps
maximizar los
the
beneficios. A
most
veces lo más
reasonable thing is
razonable
to
es
maximize benefits.
balancear la cosa para que
So
ponerle más empeño a formar capacidades para atender la equidad a largo plazo. Pero lo que no es negociable es una colaboración en que no hay un respeto, no se reconoce la contribución de las personas, o una colaboración donde hay injusticia, en el sentido que alguien que hizo una contribución no tiene no es reconocida en las publicaciones posteriores. Entonces debemos también empoderar, creo, a las generaciones más jóvenes para que no solamente para que tengan esto claro, sino para que en la práctica sepan cómo manejarlo. No sé, alguno de ustedes mencionó de manera temprana, hay que ver cuál es el plan, cómo que tener esa conversación que a veces es difícil, más aún para una persona más joven, tener esa conversación de manera temprana sobre el crédito que va a tener cada uno. Es importante. Quiero confirmar que están escuchando la traducción al inglés. Creo que
you
hubo
can hear
una,
English. I'm sorry, I
una
turned off to
brecha
cough.
en la
I
traducción
think
al
that there
inglés.
was a gap
Si me pueden
in the
confirmar que se
interpretation into
está
English. Can you
haciendo.
confirm?
Ok, gracias.
Okay,
Fran,
thank you.
ya está
I'm sorry, I coughed.
resuelto,
I'm sorry.
resuelto el problema.
It seems the problem has been solved.
Gracias.
Thank you.
Bueno,
Okay,
creo que podemos hacer
I think that we
todavía un
can
par de
have
preguntas más
a
y
couple
también hay
of
varias
more
relacionadas
questions,
con
and there are
la
several questions
capacidad
that have to do
de
with
infraestructura, de
capacity,
recursos,
infrastructure,
tecnologías.
resources, technology.
¿Tienen ustedes algunas estrategias
Do you
concretas
have
o
any
acciones
concrete
específicas
strategies, any special
eh,
action
para poder, digamos, enfrentar
to be
estos
able
retos
to cope
para
with these
trabajar
challenges,
colaborativamente, es decir, la
to work
ausencia
in
de recursos
collaboration
necesarios, ¿no? La
when you don't
poca,
have the necessary
el poco presupuesto, la
resources,
poca
when the budget
infraestructura,
is
etcétera?
tight, there's a lack of infrastructure, et cetera, et cetera.
Bueno, en general,
Well,
uno
generally
podría,
speaking,
en nuestros países siempre
in
podría decir, bueno,
our countries, you can
si hay
say,
buen
okay,
financiamiento privado,
if
uno
there is
puede
good private funding,
hacer investigación,
you can do
debiera
research.
haber transferencia
There
tecnológica,
should
no solo en
be
cuanto al
transfer of
conocimiento y
technology, not in
probablemente
terms of knowledge,
beneficiar
but also
con alguna infraestructura a algunas instituciones
provide
públicas o
some
privadas. Eso por
infrastructure
un
to
lado.
public
Por
and
otro lado,
private institutions.
aprovechar
That
de
on one
alguna
hand,
manera
and on the other, make
la
use
infraestructura pública
of the
en la
public
medida que es
infrastructure to the
función
extent
esencial
that
también de la
it
salud
is an
pública.
essential
La
function of public
investigación
health. Research is
es una
a function
necesidad
of public
para
health. It
la
is
población, para la
a
salud
need
pública, hacer
for
investigación
the
para el país,
population, for
aprovechar,
the public
generar
welfare, to
mecanismos
do
para
research.
aprovechar
So
la
use
mayor o mejor
mechanisms
infraestructura
so
pública
as
para
to make the best possible
generar
use of
investigación
public infrastructure to generate
y a la
research.
vez,
And at the
digamos,
same time,
haber una comunicación entre
there
los
needs to be
sectores
communication
privados sin fines de lucro, con
amongst
fines de lucro, con
the
el sector público. Muchas veces hay
private
barreras
sector.
legales.
You may
Tenemos
have
barreras legales
for-profit and
concretas
not-for-profit
que impiden poder
organizations. So there are
conversar
different
y en
barriers
la
that
práctica hay buenas
sometimes stand in the
intenciones,
way of
pero
a conversation. And definitely, they're usually the best intentions, but sometimes administrative rules and regulations, not only does this apply to research, but often administrative standards aren't geared to the issues that affect research. So that makes it difficult to have a formal, transparent framework for coordination between the public and private sectors with the necessary investment to promote research.
Quizás
Gracias.
Well,
algo
perhaps
algo
another
que
thing,
agregar a eso es que a
something that I
veces-
would like to add to
a
that
veces
is
hablamos
that
como si la cosa
sometimes
fuera muy
we
sencilla y como si
give
fueran
the
tareas muy
impression
simples
that all of this is so easy
y
to
son
do,
muchos actores
and that there are many
involucrados.
different
Y volviendo
actors
al-
involved.
cuando uno
And when,
hemos tenido algunas sesiones
well,
de
we
estos
have had
seminarios,
some sessions in some of
en
our
que hemos
seminars
hablado, por
where
ejemplo,
we have
sobre,
talked, for example,
sobre
about
los contratos. Hemos hablado también el año
contracts.
pasado mucho
Also
en
last
las
year,
4
we
sesiones
had 4
sobre
sessions
MBAs,
where we
sobre
talked
acuerdos de transferencia de
about
materiales, acuerdos de
MBAs,
transferencia de datos.
about the transfer
Cuando
of
vemos
materials, of
cómo en
data.
otras
And when we
instituciones,
see how
se
in
hace
other
este trabajo, vemos
organizations
que hay
this work is
oficinas
done,
dedicadas a
we
cada
see
parte
that
del
there are
proceso.
offices that are
Y
devoted to
nosotros
each
vemos que
component of the
en
process.
nuestras
And we
instituciones
see
muchas
that
veces
in
es
our
el equipo de
institutions,
investigación
sometimes
básico
it's
que
the
asume
basic
estas tareas.
research team
La otra mitad
that
de la
has
carga
taken
se le pasa al
on
comité de
all
ética
of
y el
those
comité de
aspects.
ética
The
acaba
other
siendo también
half
de abogado de
is
la
given
institución,
to the
etcétera,
Research
etcétera.
Ethics Committee,
Entonces, claro,
and
a veces
you
así,
wind up
cuando
working
uno ve
with
esa realidad,
the general counsel of the organization.
ahora
So
y
when
encima
you see this
colabora.
reality, you say, okay, it
Entonces,
is,
no es trivial,
in
y
addition
creo
to
que
all of
tenemos
this, we
que
have to
buscar
collaborate.
las soluciones
So this
más
is no trivial
sistémicas
matter. Sometimes we have to
posible.
come up with a more systemic
Nosotros,
possibility.
muchas de las cosas que
We
decía
often,
Hans
and many of
me
the things that
recuerdan
Hans was
lo que
saying,
nosotros
remind
insistimos
me
desde
of
la
what
UPS,
we
que queremos que sea
insist
la
on in PAHO,
visión
where we say we want it to
para la
be
región
a
en
vision
materia de
for the region
investigación.
in
Nosotros
the area of
queremos
research.
que
We want
la región
the
sea
region
capaz
to
de
be
liderar un ensayo
capable
clínico
of
multipaís.
leading a
La región participa en
multi-country
ensayos
clinical
clínicos
trial.
multipaís
So the
casi en la
region does
totalidad de los
participate
casos si un
in
país del norte nos invita.
multi-country trials if
Porque nos faltan
invited by
ciertas
a country from the
capacidades.
north, because we're lacking some
Estos
capacities.
obstáculos, a
These
veces legales,
obstacles,
en los que
sometimes they're
Carlos
legal
también
aspects, Carlos
reflexionaba,
touched on them
acaban siendo
too,
tan grandes
wind
que
up
nos
being
paralizan.
so big
Entonces,
that they paralyze
creo
us.
que creo que,
So
bueno,
I believe
hay mucho trabajo por hacer,
that
pero,
there remains a lot of
pero
work,
no debemos dejar que la dificultad del
but
escenario
we
actual
should not
nos
allow the difficulty of the current scenario to stop our activities, because this is related to a question I saw about inequities.
y sobre algo que creo que Carlos Serrano mencionó también,
I think that Carlos Serrano also said that there are many differences inside a country, not between countries, but inside a specific country. There are some differences that also appear also there. And if we don't change this collaboration paradigm, those who are in the worst situation not only will remain in that worst situation, but also that inequities will increase if we don't address the situation differently. We don't start generating the capacity of these groups and people to lead researches everywhere where research is needed.
replicando un lenguaje de Sions para otro tema,
replicating a Sions term for another topic, we have the moral obligation to go against these injustices and these inequities to make sure that research is always collaborative. Carlos Serrano, I see your hand raised. Go ahead.
It reminds me a different aspect that we could also discuss and think about it. It's the role of the industry in clinical studies. It's quite complex, but it's sometimes it's a relationship that is necessary when an important topic is being studied, and also for funding and sponsors. So it's a different aspects that we need also to discuss here, to also think about it, is the role of industry on clinical studies, and how the study should be designed and executed, ethical and regulatory considerations and publications. All these aspects need to be also be considered. But many of the studies done mainly in the field of cardiology and oncology have this role of the industry involved. And I was listening to you, Carla, about the role of the organization here. It's also important for also to guide which areas should be studied and involved here. Here in Brazil, we're last year and this year we're quite worried with dengue, and so it's going to be a very strong problem here, very important problem here in Brazil, and so studies are being formed on how to treat, to investigate, to diagnose, and mainly with vaccines here. So. Just for you to know, just for also share this information that's important here for us for the next months.
Carlos Álvarez.
Carlos
Yo solamente
Álvarez,
un comentario adicional, y
an
es
additional
la
comment.
necesidad de
The need
darle estatus a la investigación clínica dentro de los hospitales.
to give the right category to
Eso
clinical
necesita
studies within
presupuesto.
hospitals, and that entails the correct budget
Creo que
and
en
good
educación
prioritization.
dificultades en que vamos a depender, como
If
hablaba
this
Carlos,
is not there,
de la
we will
investigación constante
continue
y
having
compromiso
the
con nuestros
difficulties
investigadores, que
mentioned by
después de
Carlos
tener
Serrano.
objetivos para resolver preguntas
That is to
que
say,
puede ser el interés
the
para
industry
no solamente para nosotros.
should be involved because it has the capacity to ask questions that could be addressed not only to us. So
Un apoyo regional
we need a regional support that gives the right category, the right status to a study. A WHO guidance talks about
liquidar investigación en las regiones, pues nos toca
making
buscar
sure that collaborative work in a region has the right balance of the needed
Bien, muchísimas
pillars.
gracias,
Yes,
por las
thank you.
presentes
Thank
y
you
las
very much for the
presentaciones.
presentations,
Hay muchas
the
preguntas más, pero sin
interventions.
duda aportes
There are many
de
more
mayores
questions,
análisis
but we are always short of time. I thank you very much to all of you participants, and I give the floor to Carlos. Carla. Thank you very much, colleagues. I think that this is a topic that benefits us a lot at PAHO, not only the bioethics team, but also the clinical trial regulation team. So to speak, we need to scratch our head together and think on the whole range of things we need to do, from the smallest to the most challenging, and to see what specific actions can we take at PAHO. We are in a pertinent moment. In the article I presented, there's a line that says that never again, as in the pandemic, the impact of research has been so clear in the health and well-being of people. We have never before felt so clearly that the research that led to safe and effective COVID-19 vaccines, and they were implemented in our day-to-day, and the countries in the region have had a very active reaction to this, and we at PAHO, we prioritize research that was not there historically. We see that there is a big value being attributed to research, and this is seen in the action of national authorities who are working with many countries in renewing and improving the regulatory frameworks. I see a colleague from Nicaragua with whom we worked in the governance of research, and we have refurbished completely the research ethics system in Paraguay. El Salvador has a new clinical trial regulation that is aligned with international standards. In El Salvador, we have also worked on a law for research and for clinical trials, which is about to be signed into law. It's a bill that is about to be approved and signed into law by the parliament. In Trinidad and Tobago, there was also an approval of the national research policy. This policy was approved a few months ago. We see an increased awareness. There's a prioritization of new research, and we are very excited about this at PAHO, because we are not trying to persuade anybody about the importance of research, because we all know already that research is important and it translates into a greater safety and well-being of people. And now we are focused on doing better things. I have been at PAHO for 15 years already, and what I'm seeing this now, I haven't seen it before. You may count on the full commitment of PAHO when it comes to taking any necessary actions to promote investigative, collaborative investigation and collaborative research. Thanks to all, we reiterate our invitation to you to register in our list of research ethics. We will share the recording of this session, the information, the invitation to the next seminar about research. About this series of clinical trials that, if I remember well, the next seminar will be the revision of the recent review of good clinical practices, and we will also share the invitation
para el Foro Global de Bioética de la
for the
Investigación que se
Global
realizará en
Forum
Ghana
of
y que tiene como tema la
Research
investigación
Ethics,
colaborativa.
which will take in
Muchísimas gracias a
place
todos.
this year
Que tengan
in
buena
Ghana. Thank
tarde
you
y
very
vamos a
much to
dejar
all.
ahora
Have a
los
good afternoon.
enlaces para
And now I
que
will share
no
the
hayan tenido
links
oportunidad, puedan
for those
suscribirse
that
y acceder a
didn't
los
have the
recursos
chance
y a
to them to
suscribirse al
register
tratamiento,
and to
como habíamos
access
mencionado. Hasta
the
luego,
resources and
muchísimas
the
gracias.
network, as we mentioned.
Muchas gracias.
Goodbye and thank you very much.
Muchas
Thank
gracias.
you.
Buena
Thank you.
semana.
Have a good week.